You have the Treasurer and Secretary of State here. I see it as 8:02. I see Auditor Racinas. Do we have the Superintendent? I see the Superintendent. So for the record, Madam Director, I believe we have a quorum, and I would love to call this meeting to order.
Okay. Thank you, Mr. Chairman. The first item on the State Loan and Investment Board special meeting agenda today is C1, which is to consider adoption of emergency rules for Chapter 39 of the COVID-19 relief grants. You may recall, Mr. Chairman and board members, that on June 4th, the Slib adopted emergency rules in order to administer the CARES Act program that it had been tasked to oversee via the state legislation. At the August 27th State Loan and Investment Board meeting, the board thereafter adopted a different method to award coronavirus relief grant funds. They changed from a first-come, first-serve approach to an allocation method. Additionally, since the last Slib meeting, staff has been looking toward the end of the year to figure out sort of how the last few meetings should go, and the board had talked about a sweep toward the end of the year to allow those who had requests in excess of their allocation a chance to apply for unused funds at that time. So we have proposed some deadlines in that regard. So today we're asking the board to adopt the emergency rules for Chapter 39. The emergency rules that are currently in place will expire at the first week of October, and we also need to make some revisions to account for the changes in the program. So with that, Mr. Chairman, I would yield the floor to Brandy Monger and Jim Peters to take the board through the proposed changes to the Chapter 39 rules.
Thank you. Ms. Monger.
Mr. Chair, thank you. I think that they're pretty self-explanatory, but if you have any questions, we can go through. The most significant change is in Section 4, which will incorporate the board's decision to do an allocation method as opposed to the first-come, first-served method that we had been using. So this is just to reflect that allocation and to put that allocation into the rules. It also provides for sort of how we switch methods in midstream and sort of sets out the way that we will consider applications going forward, but also prior applications. The next set of changes is in Section 5. We took out the first-come, first-served language. Then we also, if you look at B and C of that chapter, the new language would go to sort of the idea of being able to sweep up any unused funds and how that process would work. So we would have those in the rules as well. Then the next change is in Section 6, and that's in B2, and that talks about the capital construction projects and just makes clear that they have to be completed by December 30th. It also takes out some of the language that was a little bit confusing, I believe we talked about at one of the meetings, as opposed to the difference between sort of capital construction and major maintenance. And so just to be more in line with what the board has actually been approving in terms of projects, we've taken out that language to be clear. In Chapter 7 is just a language change, or Section 7, sorry.
Okay.
And then the next changes are in Section 10. And here we just sort of have changed the way that the Attorney General's review is laid out so that all applications shall be reviewed by the Attorney General to certify the legality. We put that in the approval and evaluation, and we took it out of what was formerly Section 11, now Section 12, in the fund distribution. It's just to match a little bit how we've actually been doing our review and the way that the board is getting those reviews. Then the next change would be new section 12, former section 11. As I said, we moved where the Attorney General approval went. Then we've just made clear that these are to reimburse eligible expenses. And then we took out the language in former C, now B, regarding the unused portions will automatically go to the Department of Treasury, just because some of the new guidance indicates that, payments can be made as long as the expenses were incurred prior to December 30th, that payments can be paid after that. So we just took that out so that it wasn't contrary to what the guidance reflects. Then the next thing is just in section 14, new section 14, we just put in the single audit requirement that the Treasury has indicated it will require for those entities receiving over $750,000 in federal funds. And that's just to make sure that these entities are aware of the potential obligations that come with these funds. So if there's any questions, I'm happy to answer them.
Thank you, Ms. Munger. I'm going to just kind of walk through from the superintendent and auditor to others to see if there are any questions. Any questions, superintendent?
No questions from me.
Thank you. Auditor?
Mr. Chairman, in the new section 14, I do have a question on the wording. I guess I have two questions. The first one would be, I think the intent of this section is to require the applicant to submit their audit report if there's a finding related to these funds. So two kind of questions with that. It also says that they shouldn't allow the auditor to release the report until adjusting entries are disclosed. So, but if the auditor hasn't released the report, we can't get it. So I'm not sure if that wording, I may be thinking about that wrong, but I feel like we're putting the cart before the horse a little bit. They can't withhold release, and we can't get the report if the auditor is withholding release. And then my other question, I believe as part of subrecipient monitoring that is required by these funds, we may be required to get all audit reports from any entity, not just if there's a finding. So I just I don't want to muddy that up too much, but I think receiving the audit report from those entities may already be a requirement required by subrecipient monitoring, regardless of whether there's a finding.
Ms. Munger.
Mr. Chair and Madam Auditor, I think that you're exactly right, and obviously significantly better at the accounting side of this than we are as lawyers. So I'm wondering if maybe the best way to do this is just to maybe take out the if the findings to the records portion of this. So take out the last sentence of the proposed rule change. Do you think that would?
Mr. Chairman, I think that would at least maybe not contradict other things we may have to do, and it would fix the timing issue.
All right. Ms. Munger, any other comment?
Mr. Chair, none unless Auditor Sinas has other concerns.
That was my only question. Thank you.
Thank you.
Thank you, Madam Auditor. Mr. Treasurer, any?
Yep. Yeah, just for clarification, do we just take out if findings to the end of chapter, comma, and leave in the applicant shall provide one copy? Or do you take out the whole sentence? I think the recommendation was to take out the whole sentence.
Mr. Chair, Mr. Treasurer, that was, I think, the recommendation, just to take out the whole sentence, because the requirement sort of exists in its own, even without the language in the rules. Our goal was really just to bring up to the applicants that the single audit requirement the potential for the single audit requirement.
Okay, the only question that, just a clarification, I know we've had some discussion about whether things should be done on the 15th of December or done on the 30th of December. I guess we're clarifying it, that if you're in construction, that necessarily you don't have to have constructive use of the facilities within the time period, you just have to have them constructed.
Mr. Chair and Mr. Treasurer, we are clarifying that any construction projects have to be completed by December 30th. I think that there's still a question for this board on those projects as you review them as to whether they're a necessity if you will not have use of those facilities during the covered time period, make them necessary. So that still becomes a policy question for the board of necessity, but what we need to require legally is that those projects are completed because the availability of funds after December 30th will not be there.
Okay, so we're just making it clear that if they get them completed as far as the legal aspect of it and getting the funds out, that's the hurdle they have to cross.
Mr. Chair and Mr. Treasurer, that's correct.
Okay. Thank you, Mr. Chair.
Thank you, Mr. Treasurer. Mr. Secretary.
Thank you, Mr. Chairman. Two things. The first on the treasurer's comment, and I think consistent with what the board has been doing, the constructive use, I would hope, would extend past the end of the year, because although we all hope that this is over, a few weeks perhaps, they may be using the facility to directly combat whatever the language here is, COVID-19 well after the first of the year. So I'm hoping that the guidance from the feds really is that we just have to have these things completed and the funds dispersed by the end of the year, recognizing that, this fight may go on past the first of the year. The second thing is just a note, Section 10, subsection B, just statutes. Just take a look at that, correct that, and that's all I have.
Mr. Secretary, I see statutes, not statues. Okay, thank you, nice catch. Thank you. Thank you. Let me see, are there any comments, Mr. Bump, from anyone online?
Mr. Chairman, Eric Boley.
Okay, thank you. Mr. Boley.
Morning, Mr. Chairman, committee members. Eric Boley with the Wyoming Hospital Association. Just a question, and it'll come up later today as we take a look at the applications. I'm not sure if it's clearly outlined in the guidance here. We have entities that are multifaceted. We have hospitals, nursing homes, home health that are all owned and operated by a hospital district or Memorial Hospital. Under our allocation methodology, we had allocated a certain amount of money for each type of entity. And as we take a look at the applications later today, I know that OSLI has done a great job of showing how much money has been awarded to each applicant. But there are some concerns from our side, or just some clarification needed as far as whether it's cumulative or whether it should be for each individual type of entity. And as an example, we have a hospital that under the old allocation methodology has received more than what we agreed upon in our allocation model. They're applying for money for their nursing home. I would hope that the nursing home would be considered separately. We agreed that there wouldn't be any clawback from previously decided projects or allocations. And I just don't see how that's, I just want to make sure that's clearly defined in the guidance that we're looking at right now, so that as we consider those applications later, we know what we're working with. And vice versa is true. We've got another applicant where they've received more money than the allocation model for a nursing home, but the hospital hasn't received any money yet. And depending on how we account for it, what the decisions are made, the amount that they'd be receiving under the allocation model now would be less if we were to penalize them for the amount they receive for their nursing home. I hope that makes sense.
Thank you, Mr. Bowley. I think it does. I think, if I remember correctly, some of our conversation last week really referred to the entities being able to make their best allocations, and Ms. Monger is indicating that was kind of the tenor of that conversation.
And Mr. Chair, and that's correct, and I understand Mr. Boyd's concern, and we did discuss it with OSLI and the Attorney General's office, and he's right, which is you have both the problem of some entities being over allocated within like their hospital or their nursing home. And so we just decided that the best way to handle that would be to leave it to the board as we discuss those, letting you know what the allocations have been, and then the board could make the decisions and the entities could make the decisions. So I think we wanted to actually give the most flexibility to the entities to say, listen, just because our hospital got more than their allocated share, our nursing home hasn't, and we'd like to use this for our nursing home. It's not addressed specifically so that it leaves those options open.
Right. Thank you. Any comments from other members of the board? Hearing none. Thank you, Mr. Bowley, for your comment. Madam Director, any comments that you would have?
Mr. Chairman, I agree with Ms. Monger. The idea was to give the board the flexibility, but as Mr. Bowley has pointed out, we sort of have both sides here of over allocation, under allocation, individual. So it's really going to depend on the lens that the board wants to give the application. We also wanted to be mindful of the need to true up at the end of this. And so while some of these applications, like Mr. Bowley just described, are on the no fund list, it's simply because it's over the total allocation that the board had provided. But we believe the board should be able to consider all applications and the merits of them and decide if they're comfortable allocating more to these individual entities, despite the fact that maybe the overarching entity has been over allocated.
Thank you. Mr. Secretary?
Just briefly, and I'm just looking at the sheet you gave me, and I don't know if I brought from the last meeting the bigger kind of spreadsheet, if you will, of the total allocation amounts for each type of entity. Is that on here, or I'm just wondering as we get into this if I'm going to have all the information I need.
Mr. Chairman, Mr. Secretary, I don't believe that information is on your sheet. However, I can run upstairs and grab it and bring it down to you. We would have that information readily available, I believe.
Yeah, I don't think they gave that to me this morning, and I think we're going to need that. You guys probably have it, maybe. I didn't bring my laptop, is my problem.
All right. Thank you. Any further comment? Any further comment? Any further comment? So recognizing the two recommendations that have been made, I would entertain a motion. I guess, Mr. Secretary and Mr. Treasurer, it seems to me that we should put the rules in front of us and then make the amendment, or do we want to? I think that's probably the cleaner way to do that. So I would entertain a motion to approve the rules, and then after that, I guess amendments to clean up the language about statues and the remaining, the last sentence in 14C. So with that, I would entertain a motion.
Mr. Chairman, I would move for approval of the rules before us.
Thank you. It's been moved by the treasurer. Is there a second?
Second?
It's been seconded by the auditor. Any discussion? Any discussion? Now, do we take the amendments at this point? Yeah, okay. So I would, the motion's been made and seconded. If there are amendments, I can entertain those at this point.
Mr. Chairman,
Yes, Madam Auditor.
I would propose amendments in section 10B, changing the word statutes to statutes. May I make these both at once?
Yeah, I think you can make, is there any discussion on that, 10C, changing statutes to statutes? Hearing none, we'll entertain that from the motion maker. Is that a good friendly to you?
Oh, yeah.
Yep, okay, thank you.
And then, Mr. Chairman, in new section 14C, I would propose removing the last sentence, starting with "if findings are made."
Okay, thank you, Madam Auditor. Is there is that acceptable to the maker of the motion?
I'd second, Mr. Chairman.
Okay, thank you. Those are both there. We're now ready for a clean motion. Is there any discussion, or is there any sorry, not motion, but action? Is there any discussion on the amended motion? Any discussion? Any discussion? All in favor signify by saying aye or a thumbs up.
Aye.
Okay, 2 thumbs up on the screen, 2 ayes here, 3 ayes here. So that motion carries. Thank you. Those rules. Thanks very much, Madam.
Back on the motion, Mr. Chairman.
Yes.
Yeah, we passed the amendments, but I don't think we passed the motion now. We haven't passed it now.
Well, I think my view, Mr. Treasurer, is that we had 2 friendlies, so the motion was.
All right.
Thank you. All right, Madam Director, next.
Yes, Mr. Chairman, that brings us to matter J1, which is to consider 26 funding recommendations for Chapter 39 coronavirus relief grants. Just to reset the stage for the board, under the coronavirus relief grant program, the board is authorized to issue grants in accordance with the CARES Act. The relief funds may only be used on expenditures that, number one, are necessary and incurred due to the public health emergency with respect to COVID-19. Number 2, are not accounted for in the most recently approved government or entity budget as of March 27th, 2020. And number 3, are incurred during the period that begins March 1, 2020 and ends December 30th, 2020. Under the Slib Board CRG program, eligible entities include cities, towns, counties, and other political subdivisions, tribal councils after they've exhausted their relief funds provided directly by the U.S. Treasury, and Wyoming healthcare providers, rural healthcare districts, hospital districts, and healthcare facilities. Wyoming State Legislature passed legislation requiring certain criteria be used to evaluate CRG program funding. These include whether the expenditure is an appropriate use of the fund and in compliance with the CARES Act, whether the expenditures were incurred and or continue to be incurred as a direct response of combating COVID-19 in Wyoming, whether the expenditure is related to the economic impact of the COVID-19 public health emergency, and whether the expenditure is in compliance with state law. The Attorney General's Office is tasked with review of all CRG program expenditure disbursements for the board-approved grants. Today, we have 26 funding recommendations amounting to $7,179,024. They are presented for the board's consideration. Each submitted application's been reviewed by the Office of State Lands and Investment staff in consultation with representatives from the Attorney General's office. As we did last time, the applications and funding recommendations have been sorted into the 4 categories: the proposed funding, the proposed no funding, policy-related payroll, and policy related to capital construction, HVAC systems, and other miscellaneous requests. I note that we have previously provided the board with the application materials related to this meeting. We've also briefed you individually. I would be prepared to propose a consent list at this point, should the board so desire.
Thank you. Madam Director, are there any questions for the director? Hearing none, I would be happy to have a suggested consent list.
Right. Mr. Chairman, we would propose on the consent list, go to your tables behind your board matter, the Coronavirus Relief Grant Program applications recommended for funding, September 14th, 2020 Slib meeting. We would propose that those items 1 through 8 in the amount of $1,026,803 be on the consent list. And those would include Weston County Hospital District, Sublette County, Sweetwater County, Pinedale Aquatic Center, William H. and Carrie Gosch Foundation, City of Kemmer, City of Cody, and the Riverton Memorial Hospital, LLC, doing business as Sage West. We would also propose on the consent list the Coronavirus Relief Grant Program applications requesting reimbursement for payroll, September 14th, 2020 Slib meeting, including 1 through 6 on that list: Weston County Hospital District, Sublette County, Pinedale Aquatic Center, William H. and Carrie Gosch Foundation, City of Kemmer, City of Cody, all total in the amount of $1,836,570. Of course, those payroll recommendations would be subject to the evaluation of the receipts and reimbursement materials provided to the staff in the Attorney General's office, and also those conditions that are set forth in the board matter J1.
Okay, thank you. Members of the board, I am open for a suggestion on the consent list. Madam Superintendent.
Mr. Chairman, I move approval of the consent list that includes Coronavirus Relief Program applications recommended for funding. Items, I'm not going to name them if that's okay, as indicated by the director, items 1 through 8, as well as Coronavirus Relief Grant Programs application requesting reimbursement for payroll, items 1 through 6, as indicated by the director.
Okay, thank you, Madam Superintendent. Is there a second for the consent, the suggested consent list? Is there a second?
Second.
It's been seconded by the secretary. Any discussion? Any discussion? Mr. Treasurer.
Did I miss here? I thought I heard items 1 through 6.
That would be, Mr. Treasurer, that would be the second, that was the payroll.
Payroll.
Items 1 through 6.
Okay.
So that'd be Weston County Hospital, Sublette County, Pinedale Aquatic Center, William H. Carey Gotchi Foundation, City of Kemmer, and City of Cody.
Yeah. Okay.
Okay. Any further discussion? Hearing none, all in favor of the consent list signify by saying aye or thumbs up. All right. That motion carries. Now I would entertain a motion to accept the director's recommendation on the consent list.
So moved, Mr. Chairman.
Second.
Sorry, Madam Auditor, go ahead.
Mr. Chairman, I would move the director's recommendation on the consent list.
Thank you. Is there a second?
Second.
It's been seconded by the superintendent, moved by the auditor. Any discussion? Any discussion? All in favor signify by saying aye or a thumbs up.
Aye.
2 thumbs up on the screen, 2 ayes here, 3 ayes here. That motion carries. Thank you. Madam Director.
Yes, Mr. Chairman, that brings us to consideration of the applications requesting reimbursement for capital construction, HVAC, and other items, September 14th, 2020 SLIB meeting. The first item is the William H. and Carrie Gacci Foundation. The applicant has requested to purchase showers and washers and 3 dryers, I think, for their Thermopolis, Basin, and Worland facilities. The amount of the request is $43,654. The applicant states that the additional washers and dryers are necessary because the COVID-19 pandemic has increased the amount of laundry that needs to be done, and it's necessary to maintain proper sanitization. Additionally, there are no showers in the wellness center, which results in a larger amount of people who are coming up to the rehabilitation center to use one shower in the facility. The additional showers in the wellness center would allow for social distancing. The applicant also states that it may have to shut down the wellness center if another set of showers are not installed. The concern of staff is it's unclear whether the proposed expenditures are necessary in response to the COVID-19 public health emergency.
Thank you, Madam Director. Are there any questions for staff from the board? Any questions? Mr. Secretary.
Just real quick, Director, if I look at this stuff, I figured out, but number 5 on the consent list that we just did for funding for the same foundation said washer, dryer, and then is it just the showers that cause concern, and washer and dryer on this
Mr. Chairman, that application, we've sort of bifurcated, if you will. So the PP&E supplies and all, it's my understanding that those would be in the proposed recommended for funding. The showers and the washers and dryers were pulled out of that for consideration separately.
Thank you.
Thank you, Mr. Secretary. Any follow-up? Madam Superintendent.
Mr. Chairman, thank you. Just a question. It feels like we're sort of wading in 2 streams here because this is a wellness center that clearly has a medical mission, but it also shares space with basically a gym function. And I just wanted to double check that. And if I'm reading this right, the showers in particular, the showers are more for the patrons that would be using the facility as a gym versus patients and healthcare providers. Am I reading that correctly?
Madam Director.
Mr. Chairman, Jim, if you're on the line, would you have additional color on this particular application? And if not, perhaps there's somebody on the line.
Mr. Peters.
Mr. Chairman, Jim Peters at the Attorney General's office. The application didn't necessarily go into to that much detail about the patrons that would be using the wellness center versus the patrons at the physical therapy, occupational therapy clinic. So I'm not sure I have any additional color on that piece, but I'm not sure if there is an individual from the Gacci Center available.
And I was going to ask that in just a second. Superintendent, follow up.
Yeah, thank you, Mr. Chairman. And if there is someone on the line, you know, I know that there's probably a whole gamut of folks that are covered by this, but I guess I'd like some color or just a little specificity on what who the wellness center serves. Is it a patron who is staying in shape, or is it a patron, or excuse me, a patient who is utilizing the facilities to follow up on, you know, an individual regimen of maybe healthcare, prevention, therapy, what have you. So that's what I am hoping to clarify.
Thank you, Superintendent. Is there anyone online, Mr. Bump, that you see that can give us some clarity on this? Is there anyone raising their hand?
Mr. Chairman, I don't have any hands raised. I've asked if there is anyone to raise their hand, please.
Mr. Treasurer.
Yeah, when I was hearing the explanation, I had thought that the healthcare providers were actually going to the wellness center to clean up after work or whatever before they went home, and so the problem was there wasn't enough facilities in the healthcare area, but there was room to put showers in the wellness center. So, yeah, is that basically? I think that's what was going on, but I'm not sure.
Mr. Chairman.
Madam Superintendent.
Thank you, Mr. Chairman. That is exactly why I'm hoping to have some clarification, because I read it just the opposite. And then I read it the way the treasurer did. I read it as the patrons in the wellness center utilizing health facilities that, like, sharing space with patients and healthcare providers. So that's where I'm just looking for some clarification that I didn't find in the application.
Thank you, Mr. Treasurer, and thank you, Superintendent.
Yeah, I think it's fine if the healthcare providers need to utilize other facilities someplace else that they can use, you know, to make sure that you know, they're safe and their families are safe, going to and from their jobs, or the other way around necessarily. Just adding capacity to a wellness center that doesn't have a COVID mission probably isn't appropriate use of funds, but the other way around, I think it is. I think we could probably move this forward contingent that it's basically adding capacity that for healthcare providers to essentially clean up and keep that safety factor within the community.
Thank you, Mr. Treasurer. Mr. Boley, I don't see that we have anybody who can address this, and I don't know if you're familiar with Gotchi at all. But it sure would be helpful. Maybe you have some perspective.
Mr. Chairman, I apologize. I don't know that much about it. I know that the hospital and Gotchi kind of cohabitate the same campus. I don't know that much about this project though, except I do believe I've heard, and this is just hearsay, that they may be going over there to decontaminate before they head home after working. But I don't know the answer. I could try and reach out to my CEO up in Thermopolis, see if I can get some help for you, but that's all I know. I'm sorry.
Thank you. Thank you, Mr. Boley. Well, board, Madam Superintendent.
Mr. Chairman, for you know, maybe just to the threshold question for me is, are the showers for health and wellness patrons, for patients, or for healthcare providers? And I'm not sure how. I like the idea of making that contingent in a motion, but I'm not sure how we would do that. It would be really great if perhaps we could just not take action on this and see if Mr. Boley is able to reach out to his CEO to get an answer, to get clarification on that. That would be my preference, but I'm certainly willing to move forward with a contingent, or I'm willing to support a contingent motion if there is a clear way to state that.
Mr. Chairman?
Right. Thank you, Mr. Treasurer. So I'm going to take that as a motion and a second to table till the end of the meeting. Is that okay with you, Superintendent?
That's great. Thank you, Mr. Chairman.
Case, then we go straight to a vote. All in favor of tabling the William H. and Carrie Gotchi Foundation. Are there ayes? Yeah, okay, that motion carries. That motion is tabled. Madam Director.
Mr. Chairman, just so you're aware, we have reached out to staff upstairs. They're going to try to reach out to these folks at the Gotchi Foundation to hopefully be able to get somebody on the line to help us understand a little more color, or to at least obtain the information that the superintendent was seeking.
Okay, and Madam Director, I'm particularly sort of curious about, I was going to say troubled, but curious about the applicant also states it may have to shut down the wellness center if another set of showers is not installed in the facility, and I just would love to understand that more too. Thank you.
Thank you, Mr. Chairman. The next item on the requested reimbursement for CAPCON, HVAC, and other items is brought by the Community Action of Laramie County, doing business as Crossroads Healthcare Clinic. The applicant's requesting $150,000 to update and replace parts on its mobile healthcare clinic. These include a generator replacement, $60,000. It looks like air conditioning replacement, $25,000. Plumbing update replacement, $25,000. General maintenance, $25,000. Travel cost to outlying communities, $15,000. The concern with the project is necessity and the timeline. The applicant states that the funds will be used to purchase necessary updates and replacements on their mobile healthcare unit. The applicant also states it's not able to offer COVID testing at this time, but they've been able to build a program that educates individuals on COVID-19 as well as testing sites in the area. The applicant also states that the project will allow it to comply with the CDC guidelines for social distancing and delivering telehealth. The application is unclear whether the proposed expenditures are necessary in response to the COVID-19 public health emergency, and the timeline. The applicant has not provided a timeline stating the project can be completed by December 30th.
Madam Director, on the issue of at this time, that is unable to provide COVID testing at this time, is there any further discussion on that? Did they anticipate these things would assist with that, or is that just something they just say we can't do it right now?
Mr. Chairman, it's my understanding that this application is solely concerned with education about COVID, not actual COVID testing itself. And it's my understanding that that's not the plan moving forward. Is that correct, Ms. Blackwell? I'll yield the floor to Ms. Blackwell with additional detail if she has it.
Thanks, Ms. Blackwell.
Those are my understanding as well. One of the things they did state is they would use this to assess other medical conditions, so maybe not bringing people into healthcare clinics. So maybe that's also how they're tying it to COVID also.
Okay. Thank you. Any questions from the board? Any questions from the board? Do we have anybody online wanting to speak to this project? I see we have Mr. Cheney.
Yes, good morning. My name is Scott Cheney. I'm the program director for Crossroads Healthcare Clinic.
Thank you, Mr. Cheney. Welcome.
Thank you very much. Thank you for considering our application. We submitted this to update our mobile unit because, as you say, your concerns are necessity and timeline. Timeline is also our concern as well. It's difficult to assess a timeline since shipping and availability of specialists is kind of at a premium right now. And so we have been in conversations with our mechanic for our mobile unit as well as with an RV supplier. And they do believe that they can have all of these updates done to our mobile unit by the end of the year. We are very aware that COVID-19 is not going to end on December 31st. And so we are trying to prepare ourselves going into the new year, especially. And by updating our mobile unit, we're going to be more equipped to actually go to our population. We primarily see the homeless and the very low income. And with COVID-19, public transportation has been minimalized and they can't get to us. As well as when you look at the outlying communities such as Burns, Albin, Carpenter, they cannot get to us, but we can get to them. And so if we are able to update our own mobile unit to where it is in the best shape possible for us to service our population and provide them healthcare in a safe space where risk of transmission is extremely low for COVID-19, that's why we submitted the application.
Thank you, Mr. Cheney. Just a quick question on that. So what are the sorts of services that you provide out of your mobile unit?
So out of our mobile unit, obviously we can't provide everything that we do within our brick and mortar clinic, but we do provide basic wellness, CLIA-waive testing. So that would include like HIV, STD testing, and we are currently waiting on a machine to come in that can test for blood glucose levels for our diabetic patients as well. The mobile unit is also a great resource for education. We've previously received funding from HRSA, and so we have 2 temporary staff members who their whole purpose is to create a COVID-19 educational program that we can transmit from the mobile unit into the outlying communities who may not know as much or who may not have access to testing sites. And I just want to add that why we've chosen not to offer COVID-19 testing within our facility, because once grant money runs out, it's cost prohibitive for us to do it. But what we have done is we have partnered with other local agencies who are doing COVID-19 testing, such as the Laramie County Health Department and UW Family Medicine. And so we've been working with those partners to facilitate COVID-19 testing for our population.
So, Mr. Cheney, on that last point, then, do I understand that if someone comes to the clinic or asks about COVID-19 testing, you would instruct them where they can go to get a test? Or are you thinking about ginning up? Because I understand you won't have the equipment on board, but sample collection is surely something that I understand the cost prohibitive nature of this, and we have tried to provide some funding to the Department of Health and others to stand up some of that, but is sample collection something you can consider for the future? Because I think it's basically a chain of custody issue, is it not?
Yes, sir. And sample collection is certainly something we can consider in the future, for sure.
Okay, thank you. Any questions from the board for Mr. Cheney? Madam Auditor.
Mr. Cheney, thank you for being here. And I know that your organization provides a huge service in Laramie. My question is, as we battle the timelines, will the clinic be able to sustain these costs if the timeline falls apart and CARES Act funding is no longer an option?
That's an excellent question. We will be able to sustain some of the costs, not all of them. So the costs that we've asked for, so let me backtrack a little bit. Originally, we had actually planned to purchase a whole brand new mobile unit, But then when we looked at the longevity costs, we realized we could not sustain that, but we can sustain our existing mobile unit. And so we've chosen just to do the upgrades on our existing unit. So then our monthly costs will not increase.
So Mr. Chairman, sorry, let me, and I may not have asked that very well. We're in a situation where if the project is not completed by the end of the year, CARES funding is the state may not be able to reimburse for projects that are not completed. And so I guess the question is, if CARES funding doesn't come through, would the clinic be doing this anyway, and would they be able to fund it without this source of funding?
In regards to the upgrades to the mobile unit?
Correct.
No, we would not. We operate on a very strict budget through HRSA and HHS. And unfortunately, our regular budget does not allot for upgrades to our mobile unit, which our mobile unit's about 12 years old and it's starting to show its age. And so without these upgrades, unfortunately, realistically, we're looking at in the next few years that it would have to be parked.
Thank you, Mr. Chairman.
Thank you, Madam Auditor. Any further questions? Any further questions? Mr. Bump, I don't know if there's anyone else that would like to address this, just checking your list. I don't see anyone. So what's the pleasure of the board? Thank you, Mr. Cheney, for your clarifying comments. So I'm still waiting.
Mr. Chairman.
Yeah, Madam Auditor.
So this is a tough one because I want to be able to fund this. I think the necessity is gray at best. I think I could get there, especially like you said, if there was some hope of offering maybe more direct COVID services. But my real concern is the timeline and the clinics. My biggest concern through this, and I know I keep beating the same dead horse, is setting up entities to be in the hole for these fundings when the feds don't allow us to spend them on projects that are not done by December 30th. And so that's my concern. I really don't want to set entities up for that. So to get us started, I would actually make the motion to not fund this amount.
Okay, the motion's
just
been
clarify,
made.
my concern, Chairman, is with the timeline, and I don't want them to, I'm very concerned about setting them up for failure.
Okay, Madam Auditor, with your leave, let me hold your motion for just a second, just for discussion purposes. And I think you have a second from the secretary. My only concern really comes down to the comment that Mr. Cheney made, that they can sustain some of the changes, and I wanted to note that this is really sort of components, individual components. It's not an all-in project. But with that, and I guess the motion's been made and seconded,
Well, Mr. Chairman,
Yes.
sorry to be slow this morning, but that might be something I didn't understand well. Are there different components or that are done before the end of the year? Because I didn't.
Mr. Cheney has raised his hand, so let me ask him if he would respond.
Thank you. One, I want to start this with Auditor Racine's concern about setting us up for failure. We have had a mobile unit in this community for 12 years. We are able to offer mobile unit services. We are able to progress. These are one-time expenditures that our mobile unit needs. Whether you approve our application or not, we will continue to operate our mobile. We just want it to be as good as possible for the people that we see and to better serve our population. And the application has multiple components to it. So we're looking at generators, AC units, plumbing, and then the cost of travel. So there are several different parts to this whole thing. It's not just a one big lump amount.
So, Mr. Chairman, maybe I could ask another clarifying question, and thanks, Mr. Cheney, for that. So my concern is, the problem is, for example, if these things aren't completed by December, what I meant is setting up the clinic to owe money back, is if they're not completed by the end of the year within the time frame of CARES Act, the clinic would have to fund the project itself. And so that's kind of where my question was getting. For example, I see the requests say the AC got replaced, the plumbing was replaced, general maintenance and travel costs kind of happen as you go, but the generator could not be replaced, but you had already committed to it. And so that's my concern, where then the clinic would then have to fund that item on its own.
Yes, I understand that concern. We do not actually foresee that as a problem. We have, before this application was submitted, we had lengthy conversations with multiple mechanics and RV supply places that already maintain our mobile unit. And they believe that getting everything and finishing it by the end of the year is not a problem.
Okay, Mr. Chairman, and I apologize, but that's not what I thought I heard the first time.
I apologize if I was unclear on that. I'm also moving a little slow this morning.
No worries. Like I said, I just I guess with that information, Mr. Chairman, I apologize to do this, but with that additional clarification, I would withdraw my motion, but I would make another one if you would allow me to.
Let me ask, the secretary had a question let me let him ask that, and then whatever you want to do. Okay, the second is good with the withdrawal. And I think the second was essentially asking just whether it was a can or cannot proceed. So with that, Madam Auditor, whatever you have on tap.
Mr. Chairman, I would again apologize for being so wishy-washy this morning. I would make the opposite motion to approve the funding for up to $150,000, again with the very explicit understanding if one of those components isn't done, we are unable to fund it, not because we don't want to, not because we don't think it's a valid project, but because it is not in comportment with the guidelines. So that would be my motion.
All right, thank you, Madam Auditor. Is there a second? It's been seconded by the Secretary. Is there further discussion? Is there further discussion? Is there further discussion? Hearing none. All in favor signify with a thumbs up if you're on screen, or an aye. I have 2 thumbs up on the screen, an aye from the treasurer, an aye from the secretary. And so thank you, that motion carries. Next, application, Madam Director.
Mr. Chairman, the next application is number 3 on the reimbursement for capital construction HVAC and other items. It's from Powell Healthcare Coalition, doing business as Heritage Health Center. This is one of those where, sorry? Oh yes, this one was tabled from previously, so in order to entertain it, the board will have to untable it. But the under the allocation model, I'll just note for the board that Powell Hospital District has 4 separate allocations, and they total about $2.128 million. The breakdown is the hospital has $916,250, long-term care facility $650,000, Powell Healthcare Coalition, doing business as Heritage Health Center $350,000, and Heartland Assisted Living Facility has $212,000. To date, the hospital has $1,697,430 approved, so that's over their individual allocation. Then Heartland Assisted Living Facility, they have $212,000 allocated, and they've been approved for $176,250. So if the allocations were combined, Powell Valley Healthcare has $254,570 remaining. If the board does not combine the 3 or the 4 separate allocations, the Powell Healthcare Coalition, doing business as Heritage Health Center, has its full $350,000. However, this request is only for $65,000 to renovate its current facility to provide treatment to COVID-19 patients. The renovation includes new flooring, a bathroom renovation, a new HVAC system, and appropriate equipment and storage. The question that we had on it is necessity and timing. The applicants explained that the bathroom renovation is necessary because the current bathroom is very small and the sink cannot be used to safely dispose of dirty water. The proposed renovation would expand the space to create an appropriate dump station, and would allow staff with space to change clothes and clean up before leaving the facility. In addition, the project improves the HVAC system and replaces the flooring to improve infection control practices. Staff is unclear whether these projects are necessary to mitigate or respond to the COVID-19 public health emergency. HVAC upgrades have been approved for other applicants, and the board's approved a project to replace flooring for infection control for another applicant, the North Lincoln County Hospital District, at the August 27th meeting. Whether a bathroom remodel is necessary to respond to COVID is unclear. The other potential problem is the timeline. The applicant did not provide any quotes from contractors or estimated timelines showing that the project could be completed before December 30th.
Thank you, Madam Director. So I think as a matter of housekeeping, if we want to consider this, I would need a motion to take this from the table and place it in front of us.
Mr. Chairman, I would make that motion.
I'll second that.
Okay, I think that what I'm going to do is that the treasurer was making that motion as you made it, so I'm going to call you as the second auditor and the treasurer is the first on that. So with that, all in favor of taking it from the table, placing it in front of me, please signify by saying aye or thumbs up on the screen.
Aye.
Okay, it's in front of us. Thank you. Further discussion, Mr. Treasurer.
Yeah, Mr. Chairman, I think because we haven't gotten any new information back on this, and this, I believe, was the one that we wanted to make sure that the healthcare providers were using this for excuse me, I can't talk this morning, decontamination. So I think the motion would be that we approve it contingent that the Office of State Lands receives corroborating information that the bathroom renovation is to be used for the decontamination of healthcare providers.
Okay.
So it's clear it would be COVID related, and it wouldn't be necessarily for their wellness, but it would be used for that purpose.
Okay, Mr. Treasurer, I'm gonna let a couple of other people speak, but I certainly recognize that you're ready to make a motion on this, if that's okay with you.
That's fine.
All right, Superintendent, did I see you had your hand raised?
I didn't, but I'll raise it now, and thank you for calling on me, Mr. Chairman. I appreciate the treasurer's motion, and when or if that comes to fruition, I guess I was maybe thinking of three buckets: the patrons that are there for health and wellness, but are otherwise healthy; the patients who may be doing rehab at the center and need to use that maybe before going to another level of care or seeing a healthcare provider or after seeing a healthcare provider, and then healthcare providers themselves. So obviously the last two sets of customers or people are the ones that I think would be mostly COVID related versus the wellness patrons. And just knowing a little bit about you know, how some of those centers work, and I've been a wellness patron, to be sure, not a patient or a healthcare provider, but that space is shared. So I would just want to make sure that it was being accessed for healthcare reasons by patients or providers, not just by wellness patients or wellness patrons, excuse me. So that's the only clarification that I would want, and maybe just a little more expansive than how it was worded in a potential motion. Thank you, Mr. Chairman.
Thank you, Madam Superintendent. Mr. Secretary.
Thank you, Mr. Chairman. Mine is more of a comment. We tabled this and we asked for more information. We still don't have it. And I struggle with this idea that, you know, as a board, and I appreciate the motion, I really do, because it may very well be a necessity, but we basically put it back on the staff, and I know they don't mind and they do a great job, but this is approved as long as they hear back. So they have to kind of bird dog this thing, and the entity has not really responded to their satisfaction over the last 2+ weeks. My inclination is to say, until they get the information, I'd want to keep it tabled until we get that, and then it comes back before us, and then we can consider it, and the staff can say, hey, because it's kind of our job as the board to consider that information that does come back. The way this motion would be is then it's up to the staff to say, they gave us the information we need on a policy decision that's why it's in this little section. And so to me, I feel like I'm kind of punting to the staff to say, well, if you get the information back, number one, and once you do, you analyze it, and if you're good with it, we're good with it. I trust them implicitly, but I just feel like we're bypassing ourselves, and it's a responsibility that we need to undertake. Just my opinion.
Thank you, Mr. Secretary. I do see that Mr. Boley is online. Auditor Racinas, I just wanted to make sure if you had any questions, you had the opportunity to mention them.
Mr. Chairman, I just wanted to make sure I had this straight in my mind. This is the one at our last meeting that there wasn't anyone, we had quite a few questions and there wasn't anyone to explain the necessity behind the project from the clinic. Is that accurate? We had discussions about the bathroom and the flooring and whatnot, which I think we were able to read between the lines a little bit, but I just want to make sure I'm remembering the right project from last meeting.
Director Scoggin and Ms. Blackwell are both indicating yes.
Okay, thank you. That was all.
Thank you. Mr. Bowley?
Mr. Chairman, Eric Boley with Hospital Association. I just wanted to clarify, this is not attached to the Powell Valley Health, the hospital up there at all. This is a federally qualified health center, totally different entity. I've been in contact with them. They actually believe this was tabled until October. And so that's why they're not on the line, but this has nothing to do with the hospital or any of its subsidiaries in Powell.
Very good.
Okay, well, this isn't, Mr. Chairman, this isn't the one that we tabled today. This was another one? Is that what I'm hearing?
Yes, Mr. Treasurer, Director's talking.
Correct.
Yeah. Yep.
Okay,
Similar sort of ask, excuse me, Mr. Chairman, Treasurer Myers, similar sort of ask with the bathroom renovation, sort of showers kind of thing.
okay.
And I think, Mr. Treasurer, that we did discuss a number of aspects, but we had nobody who could address this specifically, so we tabled it at our last meeting. And of course, the challenge then is, in order to discuss it, we have to take it off the table, but I think it can be put back on the table, especially if the anticipation is that nobody will address this till October.
Okay.
Yes, Mr. Secretary.
Just a clarifying question for the staff, and correct me, but I thought, yeah, we tabled it, and then you were going to reach out to them or somebody, they were gonna get you more information between now and today. Can you update us on those communications? And
Ms. Blackwell.
Mr. Chairman, Mr. Secretary, we did send emails to them. I'm getting an email right now from one of my staff. We sent the email. And I don't believe that they ever responded to our email. We just are waiting for additional information.
but you did make the request?
Yes, sir.
Okay. And as of our briefing last week, you did not have the requested information?
No, sir.
Thank you.
Okay, and I see the person both in the chat, Colette Mild from the health center is prepared to answer some, or can speak to this. Is that true? And I see her hand is raised. She must be still muted, however. Here she goes. Ms. Mild, it appears you're still muted. Now you are not. Okay.
I'm sorry, Governor, I didn't quite hear that last.
You had offered to speak if needed on this particular topic, and so I'm recognizing you, and the floor is yours.
Okay, thank you. I apologize. I had been emailing your committee back and forth, and I had planned to be on the October 1st meeting with all the documentation requests.
Okay, can you, just for the record, indicate who you're with and your title, et cetera?
Can everyone hear me?
Mhm.
We can now, yes.
Oh.
Now we cannot.
This is Colette Mild, Heritage Health Center in Powell. Our legal name is Powell Healthcare Coalition.
Thank you. And you mentioned there's a delay.
Yes, everything I'm saying seems to be a minute later.
Well, the floor is yours, and you can speak to the necessity and timeline of this project if you have any perspective on that. Mr. Bump, I see she says is there a number that you can call into?
This is awful.
Mr. Chairman, there is a phone number that you can use instead of the computer. It's also on the invite that you received from Zoom.
Ms. Mild, I believe you may be trying to dial in. There are a few numbers that I see here, 253-215-8782, 346-248-7799. Board, what's your sense on this? Do we want to let Ms. Mild try to figure out how to call in and move on to the next matter until we have a clear opportunity to have her address the board? Does that make sense to you? I know this is a little bit out of order, but I'm just trying to make sure we are efficient.
Auditor was nodding.
The auditor's not, she's nodding, okay. Ms. Mild, let's, if you have a chance to, on the Zoom invitation, there are a number of numbers that you might be able to dial in. Mr. Bump, will that come to you?
Mr. Chairman, if she calls in from a phone line only, if she can chat me the phone number she's calling from, I would be able to open it up.
Okay, thank you, Mr. Bump. So hopefully Ms. Mild hears that. In the meantime, what I'm going to do is to, she says she's going to try to call in. So what I'm going to recommend is that we move on to the next matter, and when we have a firm communication established, we can respond to that. Thank you, Madam Director.
Mr. Chairman, it's my understanding that our staff was able to reach somebody at the Gachi Foundation and that person was going to call in. I'm unsure if that person is on the line now, but this might be before we move on to the recommended no funding list. If in fact that person is available, it might be the time to readdress that application.
Okay, thank you, Madam Director. Is there someone from the Gachi Foundation who can address the board on the matter of the showers and washer dryers at the Wellness Center. Please raise your hand if you're available.
Mr. Chairman, I'm told her name is Carissa Nichols, and I do not see her on yet.
Okay. All right, well, we'll wait for Ms. Nichols to.
Mr. Chairman, would you like to move on to the no funding list?
Yeah.
Okay.
That's good. Get started with a no funding list.
Okay. Mr. Chairman, that brings us to the applications recommended for no funding for September 14th of 2020. The first one is the Weston County Hospital District. The amount requested is $1,059,360. The Weston County Hospital District has 3 separate allocations that total $1,505,005. The breakdown is the hospital $810,000, long-term care facility $545,000, home health agency $150,000. The $39,122 was approved on the consent list earlier, and $574,334 on the payroll list. So by our calculations, the Weston County Hospital District has used all of its allocated funds if the 3 separate allocations were combined. Otherwise, if the board chooses to look at the allocations independently, it has $134,544 remaining for the hospital. The concern with this project is simply that the total amount requested would exceed the applicant's allocation. Mr. Chairman, if I could yield to Jim Peters to see if he has any additional color on this particular application. I believe the applicant's requesting $1,672,816 total for payroll supplies, phone system upgrades, and community notifications. But Mr. Chairman, if Jim's on the line, I'd appreciate his additional color.
Mr. Peters.
Mr. Chairman, Jim Peters at the Attorney General's office. And just to add on to what Director Scoggin said, really this is the first opportunity for the board to decide whether it will combine the separate allocations for a hospital district, including the hospital, the long-term care facility, and the home health agency. If the board decides that it wishes to combine them, then the entity, Weston County Hospital District, is over the allocated amount. If, however, the board does not wish to combine those 3 separate allocations, then the Weston County Hospital District has $134,544 remaining in its allocation, and the board can approve that amount for payroll.
Okay, thank you. Questions? Comments, Mr. Treasurer?
Mr. Chairman, I want to have a clear understanding. So we're asking whether or not we want to combine the healthcare facilities with the cities, towns, and counties is for, to get a total cap, a total county cap, or?
Mr. Chairman, Mr. Treasurer, this is just for healthcare entities. Weston County has a hospital, a long-term care facility, and a home health agency. And so if those 3, the question is whether to combine those 3 entities or not to combine them.
And the cap is, we have a healthcare cap and a local government cap. Where's the cap coming in? I'm trying to understand where the cap is on healthcare here.
I think you're, so what,
Ms. Blackwell.
excuse me, sorry. I believe what Mr. Peters is trying to explain is that Weston County Hospital District has several DBAs, and each DBA had their own individual allocation. And so rather than looking at the DBAs individually, which is broken out by the long-term care, the hospital, and the home health agency. Do you want to look at those individually at their allocation, or since they're all Weston County Hospital District, do you consolidate or add all of their allocated amounts together to determine this is the amount that's going to go to that entity regardless of where it was allocated? Does that make sense?
Clear as mud right now.
Mr. Chairman.
Mr. Secretary.
Yeah, I was trying to find that spreadsheet, but you're saying the allocations we did in the last meeting were down to each individual entity, basically, is what?
That's correct. So this is the opportunity to combine them all.
And Mr. Chairman, if I might, and the concern is that some of the prior funding requests and approvals by the board may have been over the allocated amount once those amounts were assigned. And so this is just another way that the board can think about the total amount that's already been allocated to the entity itself, and whether it wants to go further and look individually, or whether it, when we do the true up, if you will, in November, we're going to have to sort of figure this out too. And so it's just a matter or a way for the board to be conscious of the total amount that these facilities will be getting.
Mr. Secretary.
Let's think about, is there a danger, especially with DBAs, where there may be a lack of communication because they could be nonprofits or otherwise, where if we said, we'll combine those, that we could, if we gave more money, for example, to this district or somebody else, there wouldn't be any money left for another entity that came late to the game. So in other words, yeah, we're going to expand now to say, yes, we might approve this application, but we do it to the detriment of somebody else who we sort of allocated money to, even though they haven't applied to it. So it's still, we're back to kind of a first come, first serve, which sort of might defeat the purpose of the allocation to begin with. So just wanted to throw that out there.
Thank you, Mr. Secretary. Madam Auditor or Superintendent, any questions? I do note that Ms. Cadwell is on, and also Mr. Bowley. I don't see either of you really wanting, so Ms. Cadwell, let me recognize you.
Yes, thank you, Mr. Chairman, Governor, and board members. I appreciate the opportunity and definitely appreciate all the support you've given our facility in prior grants. Just to give you a little information on how this one came about is our prior two grants, one was for the isolation rooms in the hospital, which that project is well underway, and the other is for nursing home, the updating the HVAC systems, and that is in the beginning stages. We put together this application before the allocations were determined in hopes of some additional help, particularly with our, of course, payroll portions that we've had to do to accommodate the COVID, as well as the supplies and PPE items. And so it was kind of before the allocations were done. And I certainly understand wanting to make sure that, everybody's treated fair in the healthcare arena, so to speak. We obviously still have that need. And although we have received other funds from the CARES funds directly, we continue to struggle with getting supplies and staffing all of our facilities, whether it was a hospital or nursing home or home health. So we view this as kind of additional help, particularly to those entities. So that's why the submission was for the total amount of the $1,672,816. I understand how it was brought back to our allocation level, and looking at what our expenses were if I were to remove the nursing home direct costs from the grant that we submitted, we would need $177,298 for the hospital and the support systems and home health to kind of meet that need. But certainly understand the situation you're in and that determination too. So with that, if you have any other direct questions, I'd be more than willing to answer those.
Thank you, Mr. Secretary.
Yes, Mr. Chairman and Ms. Caldwell, just a quick question on, can you provide a little bit more information on the phone system upgrade and how that's related to COVID for us?
So one of the things that we had been understanding is that there was a need and where the funds could be used to upgrade some of the IT security, et cetera. And so it was actually a very minimal cost. It was like $1,100 total. And when staff at the Slib board asked, what was our priority, I actually removed that. So the supplies and PPE is just the $39,122 that you had approved prior to this. So that was no longer in the amount.
Mr. Secretary, any follow-up?
No, thank you.
Thank you, Ms. Caldwell. Superintendent or auditor, any questions?
Mr. Chairman, just one clarifying question, just to make sure I understand. Of the amount that is currently on the no funding list of $1 million and change, so the phone system was only $1,100 of that. What is the rest of that amount that is currently recommended for no funding? Or what's a rough breakdown of that?
Sure.
Mr. Chairman, Auditor, I think I can explain that, but I defer to Ms. Cadwell if she wanted to speak to that.
Sure. Thank you again, board members. Basically, that breakdown that is what's requested of that is mainly salaries and benefits for hospital, home health, and the nursing home, which again, if we remove that nursing home portion, the addition would be $177,298.
So, Mr. Chairman, essentially, it's probably almost all payroll.
Correct.
Thank you.
Any follow-up there, auditor?
No, Mr. Chairman.
Mr. Treasurer, any questions?
I think in these situations here that the construction stuff we've already approved, we've gone over in a lot of different places. I think we've already crossed that bridge, so in a lot of different places. But in the area of payroll, I think that's one of the ones that's fairly easily prorated at a later date. And I think we're going to get some more requests for payroll as we go forward, but that's something that can be prorated, I think. So I think it's probably a good recommendation to not fund at this time. But letting people know that unless things really escalate and you get some huge spikes in COVID, that there's probably going to be some money left for payroll out of that $50 million. So, it might be 20% or it might be 80% or it might be 10%. We don't know until we cross that bridge.
Thank you, Mr. Treasurer. I see Mr. Boley has his hand raised, and I think this is to the point you began the discussion. So, Mr. Boley, I'm going to recognize you.
Thank you, Mr. Chairman. And yeah, this is a great example of what I was trying to address early on. I see things a little bit differently, and you know, we, in good faith, we tried to work with the Slib on an allocation model or methodology that worked for each type of entity. And I don't, we also talked about clawbacks. I think potentially this looks to me like a clawback. They're being penalized for what they were approved for on other projects, and one of their entities is being penalized if we actually start using cumulative totals as opposed to looking at each individual facility. My members are ready to work with the allocation model, but this is one of the problems we have when we change the course midstream. So I would ask that you approve up to what the allocation model allows. We'll have one more situation later on with Campbell County too, where they've received funding for their hospitals. We haven't received any funding for their nursing home. And again, I would ask that these be considered separately as opposed to cumulatively.
Thank you, Mr. Bowley. Any questions from the board?
Mr. Chairman, sorry, I'm getting too many numbers confused. I guess this question would be for staff, and I apologize because I think this is somewhere on a spreadsheet that I'm having a hard time finding right now. So we heard from Ms. Cadwell that the hospital, of the amount on the no funding list, the hospital portion was 177,298. Maybe from staff, what is the request? Or maybe this is the right question to ask. Have they delved into that request more deeply to capture its appropriateness, or did we just say, gosh, they're over the allocation, so we're not going to address that now?
Ms. Blackwell or Director?
I would, Mr. Chairman, I would defer to Jim Peters, but I believe they did delve into it, and on these applications where we had to make a line in the sand of where to cease the recommendation of funding, we did work with the entity to ask them to prioritize the items within their application so that we could get the items that were the highest priority to the applicant on the funding list, if that makes sense. But I think Jim may have some more color to add.
Mr. Peters.
Mr. Chairman, Madam Auditor, the request was for a number of items, including PPE, but largely it was for payroll, the initial application. When staff reached out, we were given a priority list, including PPE, which this board has already funded earlier today, and then the remainder amount was for payroll. The board previously or earlier today funded a large portion of the payroll amount on the payroll list. And so all that is remaining right now is additional payroll. So the question for the board is, if the board wishes to treat the three separate entities and their allocation amount separately, then the board can fund an additional $134,544 for payroll. If the board chose to combine all three allocations, then Weston County Hospital District would be over the allocated amount, and that's why they're currently on this list. Does that help answer your question, Madam Auditor?
It does. Thank you for that.
Okay. Mr. Secretary.
And I think the threshold question is as he just described it. Are we going to defeat the purpose of an allocation model? And it all depends on the last deadline under which all of these other entities on here can apply and have time to do whatever project they want to do. And I guess someone would have to get out a calculator and figure out, if you approve something like this, do we redo the allocation to take away, the overage, divide it by however many other entities are out there or in a particular category? It's a philosophical question. Do we want to, we said we're going to do an allocation, And I guess we give all of these entities time to apply. But if we go over, if we combine it so that we could approve something this big, it could affect somebody. And how much time do we have to kind of see what comes in the door? And then how much time do we have once we do that to say, okay, now, since this is payroll especially, this isn't a construction project, they would have time, like the treasurer said, you might get 80%, you might get 10%, but it's payroll. It's something it's not a timing factor of whether or not it would be used up for eligibility purposes or analysis. It's not a construction project. So to me, it would make sense that we, on this one anyway, timing's not going to be an issue. And if we go away from our allocation model, the potential there is to hurt somebody else, or we're taking away from somebody else. And we just made this huge policy shift to go to an allocation model, and now we could basically go back to first come, first served.
So, Mr. Treasurer.
And I think, you know, if this 134,000 was for HVAC, and it was the hospital, and if you did it differently, as far as rather than accumulatively, I would say, yeah, approve the HVAC. But because it's for payroll, which can be essentially proportioned at a later date when we know how much money we have, then I think it's reasonable not to pay it at this time and look at a proportionalization of the remainder toward the end. But if it was for a construction thing that we knew that could be done by the end of the year, then that puts it in a different light.
So if that's the case, I'm happy to entertain a motion.
Mr. Chairman, for discussion purposes, I would move to adopt the director's recommendation for applicant number 1, Weston County Hospital District, in the amount of $1,059,360.
Been moved by the secretary. Is there a second?
I'll second.
Seconded by the treasurer. Is there any discussion? Any discussion? Any discussion? All in favor of the motion to adopt the director's recommendation, signify by saying aye, or a thumbs up if you're on screen. Aye. That motion carries. Thank you, Ms. Cadwell and Mr. Bowley, for your comments. I'm going to recognize Ms. Mild, and we'll finish with that. And then I think we'll take a brief break and just kind of get ourselves calibrated. So, Ms. Mild, I'm hoping that you're able to address us. I see you have number 307-271-1442. Mr. Bump, is she able to speak?
Mr. Chairman, she is able. Please unmute.
Hello?
There we are.
Okay, I apologize for all the technical difficulties.
Yeah, that's just the age we live in, but thank you. And so, again, let's take it from the top. You are with the Powell Healthcare Coalition.
Yes, so I'm the CEO at Powell Healthcare Coalition, and our DBA is Heritage Health Center. So at times, sometimes those get intertwined. And we are looking at a project. Right now, we have a single clinic that just goes, basically only has 4 exam rooms, fairly limited, but we see a number of, obviously we're primary care, so we see a ton of flu, common cold, that kind of thing. And so we are in a position where we can do some remodeling of one of our other facilities to create a viral walk-in clinic, so that during the flu season, we're able to separate out those people with flu-like or COVID symptoms, because there's really no way to tell the difference. until they've been tested from those of our patients that are, our chronic cares, our regular primary cares, our wellness visits, because we don't want to prevent people from their regular care, but we still want to be able to keep those that are experiencing those symptoms to be able to get care as well. We've noticed that we've had several people that have called in, needed a screen for COVID. We've referred them to the respiratory clinic and they're not making it over there. So we're losing people in the community, and it's not safe for the community or the patient. So our needs for this building renovation are currently it's carpet. Carpet is not very cleanable, especially when you're talking about a respiratory issue where people are coughing and that sort of thing. So we would like to redo the flooring in there to a vinyl tile so that it's cleanable. We'd like to update the HVAC system to utilize a more HEPA filter so that the staff and the patients have a better air quality and flow going through the building, as well as right now it's a very small singular bathroom, and it doesn't allow for what we have to do is basically create portable sinks, kind of almost a portable exam room. And so we'd like to increase the size of the bathroom so that we're able to dump those portable sinks, fill them up, as well as have an area for staff to change clothes and kind of clean up before they leave after they've been at that respiratory clinic all day seeing patients. So those are kind of the basis of those. And then there is some other costs within the application. And those are just things that you don't, that aren't necessarily major incurrences, but they would be small, obviously tables, the portable sinks, and then a few other items that have come up as we've kind of manifested this clinic of other things that we would need to make it work. So that's the overall picture of it.
Very good. Thank you, Ms. Mild. Are there questions? Mr. Secretary.
Thank you. Is this facility located in Powell or Grable? Or
Powell. We have a.
Go ahead.
Oh, I was going to say, and I'm sorry, I apologize for cutting you off, not letting you finish. We have a second location in Grable, but the renovation is for our Powell location. And I did chat with a few members of the board and had planned to resubmit the application with final quotes and all of that on the October 1st meeting, and that was a big part of why I wasn't on today. I thought that I was supposed to be submitting all of that to you guys for a final review on October 1st. So I'm not sure if that makes a difference in the discussion today, but I should have finalized quotes by then on the entire project.
Thank you, Ms. Morrow. I see Auditor has raised her hand. Auditor? You are muted.
Sorry. If you could speak a little bit about the timeline of the project, has this already been started?
Yes, I've actually got both contractors ready to go. They are planning to start later this month, and I've been assured it'll be done before the middle of November.
So, Mr. Chairman, this is not an extensive, and the price supports that. This isn't an extensive knocking down walls remodel. This is new flooring. So I guess that makes sense. That makes sense to me that these things can be done fairly quickly. One other question. Help me understand what you're doing in this space now, because I thought I heard you say this is going to become a separate area, like a viral clinic.
Yes. So currently we are. We do both behavioral and medical care. So currently our behavioral staff are in this building. with COVID, and we received some Health Resources and Services Administration funding, our behavioral health have actually kind of outgrown that space, and we're needed more to also include our enabling services. So we actually leased some space on the opposite side of our clinic. And if you're, I don't know if anybody's familiar with Powell, but we are right downtown. So there's 3 buildings that are adjacent to each other. So our medical clinic is in the middle. We've leased space to the left for our behavioral health, enabling administrative services. And then a space to the right will be our viral clinic. And it's right next door to the medical clinic. But currently our behavioral health and some administrative staff are in that building.
And Mr. Chairman, so they would be moved out to elsewhere to create room for this viral.
Correct.
Okay, thank you, Mr. Chairman.
Thank you, Ms. Miles. Any further questions? Any further questions? Mr. Secretary, you have a comment?
I would say, from my perspective, upon receiving that bit of information, I'm much more amenable to the motion I believe the treasurer made previously, because the board has received information on the timeline, the location of the project, the extent of the renovation, and so I think it is now just a matter of that being provided to the staff, and so I don't feel like now it's like we're passing the buck to them to make a decision. I guess I've heard enough from her to feel more comfortable with that. So.
Perfect. Thank you. Any further discussion? Mr. Treasurer, would you like to make your motion?
I guess they're going to show back up in October, so I can wait till October. I was actually making it for like Dorsey's one.
Oh, okay. Madam Auditor?
Mr. Chairman, if the treasurer could put his microphone on, please, that'd be super.
I was just saying that I was thinking of the Gorsuch one in Thermopolis and wherever, rather than the one in Powell. So I'm fine with waiting till October, or I can make the same motion, and if you guys are comfortable with it, if staff is comfortable with it. So, okay, Mr. Chairman, I see some heads nodding. I guess that what I would make is a motion to approve this contingent upon staff's receiving cooperative evidence that it's going to be used as stated. I think that's pretty much what I said before. Not quite, though.
Okay, thank you. Mr. Treasurer, is there a second? Is there a second?
Yeah.
Okay, it's been seconded by the Secretary.
Problem is that the price might actually change because they haven't got different bids.
Well, and I understand that, but I think we'll do that. So I see the superintendent has a question or a comment.
Yeah, within the scope of this motion, we still have the boilerplate language that applies to all of these motions regarding the treasurer's concern, and I'm stating that, but I guess it's also a question. Just making sure that that boilerplate language that the auditor articulated and refined during our first meeting is still at play with all of these motions. And that would be for staff.
And I think that is understood. Thank you very much. Any further discussion? Any further discussion? Any further discussion? All in favor of the motion from the treasurer indicate with an aye. I have 2 thumbs up on the screen. That motion carries. So for those online, I'm going to recommend, thank you very much. What what we're going to do is we're going to take a little bit of a break. And when we come back, Mr. Bump, I think if it'd be great to know if Gotchi has actually gotten online, and just track that. If that's the case, we'll deal with Gotchi first, and then we'll move to the remainder of the sheets on the no funding, which would be Campbell County Courthouse modifications, Sweetwater Entertainment and Craft Supplies, City of Cody sanitizing equipment and technology, Campbell County Public Land Board Camplex branding and remarketing equipment, Campbell County Health imaging lab equipment, Campbell County Health IT hardware, Campbell County Health legacy enhancements, Campbell County Health equipment. Madam Director, I think those are the remaining items. Is that correct?
That's correct, Mr. Chairman.
Okay, thank you. Well, we'll come back in at about 10:15. We may be done before lunch, but maybe I've jinxed that. 10:15, and I'm going to call us back to order. Thank you. I have the auditor online, the superintendent, I'm sure will be here shortly. Treasurer and the secretary are here. Gotchi is available whenever you want, is on my screen. Let's take that matter up again. Let's see. That is application number 1 on the no fund or the HVAC list. Is that correct?
Yes,
Madam
Mr. Chairman.
Okay. Thank you. Ms. Sharrow, let's just make sure you are able to address the board, if that's okay.
Yes, I am. Can you hear me?
We can hear you. That's great. So thanks. Let's. If that's the case, then just housekeeping matters. If we want to continue this, this matter has to be pulled from, or I guess we tabled it, so it has to be pulled from the table.
Mr. Chairman, I move that we place this matter back on the table.
Thank you. Is there a second? Is there a second?
Come on, not on screen.
It's been seconded by the superintendent. All in favor signify by saying aye.
Aye.
Thumbs up if you're on screen. Okay, that matter is back before us. Thank you very much. The questions that arose from this, do you want to just briefly go back over this, Ms. Blackwell or Mr. Peters? Ms. Blackwell.
Mr. Chairman.
Or the director. All right.
Okay. Mr. Chairman, the applicant's requesting to purchase showers and washer and dryers for their Thermopolis Basin and Worland facilities. The concern staff had was the necessity piece. The applicant stated that the additional washers and dryers are necessary because the COVID-19 pandemic has increased the amount of laundry that needs to be done, and it's necessary to maintain proper sanitization. The applicant also stated there are no showers in the wellness center, which results in a larger amount of people who are coming up to the rehabilitation center to use the one shower in the facility. The additional showers in the wellness center would allow for social distancing. The applicant also stated that it may have to shut down the wellness center if another set of showers is not installed. Again, the staff believes it's unclear whether the proposed expenditures are necessary in response to the COVID-19 public health emergency.
Okay, thank you. And we've had a bit of discussion about this earlier. Is there any further comment that, Superintendent, did you have a comment you wanted to make?
Mr. Chairman, would this be the appropriate time to ask the question that we raised earlier?
I think it would, and then we have Ms. Sharrow online.
Fantastic. Thank you, Mr. Chairman. So my discussion item and one of the questions that we had was just trying to get some clarification around who would be utilizing the showers and the washers and dryers. Would it be wellness and health patrons? Would it be patients? Or would it be healthcare providers? And if we could just get that question answered, and as well as we were just looking for some additional color on the project and the purpose of the project as it relates to the requirements of the CARES Act funding, excuse me.
Thank you. So, Ms. Sharrow, you have the floor.
Thank you. Thank you also for considering our grant request. I will address the shower situation first. The showers are only for our Thermopolis facility. Right now, the way we discharge, it is part of our requirement as a state license to discharge our patients to the next level of care after they've been treated. We have encountered that in the wellness center, it's almost not possible to continue to operate it unless we do have a better arrangement where they are able to use the showers before and after training or working out. This is not just Gotchi, it's our only facility in our community. We don't have like a Boys and Girls Club or anything like that. So it would be also used extensively for the community. We have about 300 paid members, and it's a very low pay that do come here. And then we have patients from upstairs with only one shower. That has become challenging. We have senior classes that sometimes they have some issues that we need to shower them. We pick up the seniors by bus throughout the community to offer them the ability to be able to work out in Gotchi. The cleaning and the sanitizing is become way excessive, as I'm sure the governor is aware, because we can't operate the gym unless we have ability to clean and make sure that the seniors are clean and encourage them in some cases to shower. Was that sufficient, or do you have any questions on the showers? And then I can explain to you about the washer and dryers.
So let me just pause there for a second to see if there are any further questions. I do have one, and that is on this statement that says something about if there are, if we don't have another set of showers, we'll have to shut down the wellness center. Can you just explain that a little bit?
Well, the showers have been excessively used, and we only have one female and one male upstairs in our facility, Governor. And we have the hospital. Some of them are coming over and using it. We have what you call a swing bed status with the hospital. And so our occupational therapists, a lot of times on swing bed, bring the patients down to shower here if they're going to work out in our gym. And it's also training. And so it's pretty occupied. And if we have to maintain all of this COVID requirements, we do need extra showers because we can't operate and make sure that they're all encouraged to shower. Some of them come right in off the ranch or the farm or whatever, and especially seniors, and they need to be clean in order to use the equipment. We were pretty lenient about it until all of the COVID came up and all the challenges that we are facing to maintain a gym and an open facility for our entire community, because we are the only ones in this community that has anything like that.
Okay, thank you. Madam Superintendent, do I see you have a question?
I don't, Mr. Chairman, thank you. And I'm not sure that I have a question so much as just a clarification that the showers would be used by paying patrons of the center who are right now using the patient facilities to shower. Is that what I'm hearing?
Oh, it's not just the patients. It's the wellness members who become.
Right. The
So-
paid wellness members.
Correct. And then on the washer and dryer, the one thing about those, these are way updated with much hotter temperature. What we used to do, because we didn't really have a lot of rags and sheets and towels and that kind of stuff, we would just transfer it all to the hospital, and the hospital would wash it because they're right down the hall. But they're not able to do that due to their excess. So, and we have a washer and a dryer, but not to the heating level and the steam and the power that does a total disinfecting. It's more like a home washer and dryer. And it's on its last leg because we're washing all day long. We've got to wash any of the sheets. We have like a massage bed, but it's those dry ones where you see that they massage, but they're on water underneath. And those have to be changed, and the pillowcases and everything after each member or after each patient. So the towels and all of that has become excessive in all three facilities right now, Thermont, Basin, and Whirlwind. So what we're asking for is, well, Krista, maybe you can explain the steam, how that works.
It's just to be able to clean especially the towels and the rags a lot better. The ones we have are kind of just the cheap home. They're not very great washer and dryers at this point, but with the amount of rags that they're using, because they have to wash down each equipment after each person gets off of it, they're going through a ton of towels and rags and that kind of stuff. So it just helps with the steam. It's supposed to help keep those things a little bit cleaner.
Okay. Now, Auditor, I think you had a question, and then Superintendent, I'll recognize you after the Auditor.
Mr. Chairman, I think this question is for staff, just a clarification. We approved washer and dryers already on the consent list. And so my question is the remaining amount in play of $43,654. Now I know the project type says showers and washer dryer because it's a split application, but does that amount just contemplate the showers? Or are there washer and dryers yet to be approved or denied in that amount?
Ms. Blackwell.
I'm going to have to defer to Mr. Peters on this, to be honest with you.
Mr. Chairman, Jim Peters, the amount on the fund list was for a number of items: foggers and disinfectants, cleaning prevention supplies, wall dividers, sneeze guard shields, and then there was an additional amount on the payroll. This amount that is on the no funding list is strictly just for the showers and the washer and dryers.
Okay, thank you.
Okay, so Mr. Chairman, just to follow up, the $65,930 did not include washers and dryers.
Mr. Chairman, Madam Auditor, that is correct.
Thank you.
Thank you, Madam Superintendent. I think you're on mute.
Yes. I wish they could see us.
There we go. I'm sorry. My question is also for staff, and it is just a clarification. It may be for Jim as well. A clarification that the crux of the bathroom the showers seems to be for the paid wellness clients or patrons or whatever we want to call them. And if that's the case, is that acceptable under this bucket of funding? And then the second question for staff is, do we have a split out of the cost of the washers and dryers only without the shower renovations? So 2 questions.
Mr. Chairman, I could take this one. We do
Go
have
ahead.
a split out of the washers and dryers for the 3 sets of washers and dryers. The total is $5,523. And your other question, Madam Superintendent, is the concern is necessity as well, and whether this expenditure is necessary in response to the COVID-19 public health emergency. So you are correct. That is a concern for this board to consider.
Yeah, Madam Superintendent, just to follow up if you have one, otherwise I'm going to recognize the treasurer.
No follow-up. Thank you, Mr. Chairman.
Thank you, Mr. Treasurer.
Yeah, I guess when I look at this, what you have is the normal patrons, and they've been using the shower, I guess, as a manner, course of business, and then when the COVID comes in, then additional, I guess, additional demands have been on the showers, and which we're at a situation where if you're going to, I guess, recognize those additional demands from COVID, then and not make a modification to the facility, then the wellness center would have to suffer, and you would err on the matter of caution and allow just the showers for the decontamination for COVID to prevail, because it is a health concern. So my question would be, is in the design of the new shower facility, can it be separated from the existing wellness shower facility? And our concern is, as a matter of necessity, that these funds necessarily shouldn't be used for a gym shower, but should necessarily can be used for decontamination purposes of patients or staff, or COVID necessary decontamination. So that's the question that I would have in the design, as to whether or not they can be essentially used for 2 different purposes during this time period.
Thank you, Ms. Sherrow.
Yes, do you have anything? The thing is with the showers, we never even considered this. I don't know if you all know, we just did, last year, we just did a complete $5.5 million renovation with donor money, grants, and everything we put together. We had no idea that we were going to be hit with COVID and so much necessary things happening, like those wall dividers. Those are those plastic shields to divide even the patients off and all of that. I feel it's all very much in protection of contamination. We do have a couple of therapists in the morning that utilize our showers when they have to come in early. If they feel uncomfortable or they feel exposed or anything of concern, they utilize the showers just as much as anyone else. And it's not just for wellness paid members. I don't know, our wellness center is to encourage people to continue strengthening, and we have such a large senior base here. We scholarship over 50% of those people because they do not have the money. So it is not a money-making situation by any means. And I really feel it's, I mean, we would have included this in the renovation had we had known about our COVID situation at that time when we did our planning, but we didn't feel the need for it. And as far as the washer and dryers, I don't think those are all for wellness, not for wellness for our patients. And upstairs, like in Basin and Werlin, they don't have the facility here. That's strictly for patient care.
Follow up.
Thank you. Yes, please, Mr. Treasurer.
So I guess my question is, are you just adding extra shower stalls in the same room, or are you adding a different room?
No, it's downstairs in the Gotchi Wellness. We don't have any down there at all. And it's even kind of complicated because it is in the basement and they have to do a whole pump up system to pump up the water and pump it out of the building. So that's what was extensive. A lot of that's in the plumbing. And then in order to put them down there, they have to blast out the concrete and run new piping and drainage and all of that also. Because I thought 60,000 was a bit high, but that's labor intensive because there is nothing down there right now.
So
And that space downstairs is about 18,000 square feet.
I think if we get a yes answer to the question I'm going to ask you, it might be something that we could move forward on. And the question is essentially are these new facilities primarily going to be used for the impact of COVID-19 in relationship to showering for individuals who need to protect the community and their family from possible contamination?
Yes, absolutely.
Thank you.
All right, thank you. Further discussion? I see the auditor and the superintendent. Auditor, I'm going to recognize you first, then the superintendent.
Mr. Chairman, if I could just sort of state what I think the situation is, and then Ms. Sharrow or staff could correct me. So my understanding is there's the rehabilitation center and there's the wellness center. The rehabilitation center obviously serves a variety of medical purposes. And the wellness center may serve that same clientele, but can also be joined by me, you, and any other member of the public. There has never been any shower facilities in the wellness center. They have essentially operated that gym without shower facilities, just as some gyms have showers, some don't. However, clients, the paying public and scholarship individuals alike have been allowed to walk to the rehabilitation center and use the showers there. And so this request is to add showers to the gym, essentially. I just wanted to say that out loud and make sure that's an accurate portrayal of the situation as it stands right now.
And Cheryl.
Yes. However, the wellness people have continued to use the showers upstairs. We have many, our gym opens at 5, and we have many that utilize the shower upstairs. But due to the COVID and all the requirements and everything, and now requesting more cleanliness, I guess you would say, by the therapist before they work on a patient, and also downstairs. We weren't very pushy about people coming in off of the farm or cleanliness and all of that, but now we're requiring it. I mean, if you come in dirty, you need to take a shower before you're able to use the equipment. And that has always been and encouraged for the upstairs, but the impact on the upstairs shower is more important to be sure that we're able to have the therapist be able to shower when needed, and also the patients. And so the impact, like I had said earlier, has been excessive. And I wouldn't even have considered it a year ago when we were doing the project as a necessity, because we felt that showers up here were adequate for both.
So, Mr. Chairman, maybe a quick follow-up. I get, and I think most of us probably go to a gym or a yoga facility or whatever that has, gone through a variety of transitions during this time. And I know that most of the facilities I'm familiar with have just shut down their shower capabilities during this time. And I'm just wondering, Ms. Sharrow, has there just been, so you have not just stopped members of the public from using essentially the medical facility shower?
No, but we were shut down completely due to the requirements from the governor's guidelines. We were completely shut down. So it's just all of a sudden that we're back open and we're hit with the influx and of additional needs to protect everybody. I think if I could explain the facility, it's been here 65 years and there's 2 levels. There's a total of 38,000 square feet. The upstairs is all connected by a wall to the hospital. So my therapists are going to the hospital to do do inpatient care. We do all the physical therapy and the occupational therapy and all that. And then on patients that are in occupational, you work with them on a daily ADLs. And if they're backlogged there, they bring them down to our gym here. And then they teach them to be back comfortable to being able to shower alone and all of that. And due to everybody's demands between the hospital and the 1 showers up here for 1 male and 1 female. In fact, sometimes if it's 2 females, we're using the male shower also. The demand has just become higher. And now that we've opened back up the gym with great thankfulness to that being able to happen, these patients, when they're finished with their therapy, they're transferred downstairs with 2 weeks free membership and training to encourage them to continue strengthening and all of that. So we're encouraging them to shower. You'd be surprised, there's a lot of patients and community people that we've never questioned any cleanliness until this COVID came out.
Thank you. Madam Auditor, any further?
Yeah, Mr. Chairman, I guess I don't think this is so much of a question. I guess something that's confusing me a little bit, and I know we are all armchair epidemiologists during this, is I know a lot of the recommendations and protocol were to shut locker rooms down and close showers to reduce disease spread. And so I guess I'm still a little confused. I'm still having a hard time connecting the showering with COVID prior to a workout.
They used to do it.
Trouble getting there.
They used to do it. For example, they were all using the upstairs shower. We have a lot of oil field workers that come in to do a workout, and they have to shower, and they shower in our shower upstairs. It's only due to the fact of the COVID. We would have never put these showers or considered them until the overload has become excessive due to COVID. And I think maybe we're not like a typical YMCA or anything like that. We have senior classes downstairs. We get assistance to, they're low, they can't afford to pay. We don't charge them. We don't charge them to pick them up or anything. And some of these people, they don't shower, period. And we've never put a demand on it, but now we have to in order to protect the other people coming into the clinics, into the facility. I'm not sure I'm answering your question the way you want to hear it, so shoot it back at me if you need to, that's fine.
Madam Auditor, if there's nothing more, I have the superintendent. Okay, superintendent.
Thank you, Mr. Chairman. I like the auditor's approach and strategy of trying to state what I think I'm hearing and then get some either clarification or confirmation that that's the way that it is. I know we're spending a lot of time on this, and given the the importance of this, the primary concern is the patients. They have they have a place to shower upstairs. So the allowance of patrons from the wellness portion of the center, the wellness patrons, allowing them access to the patient showers is something that you've deemed necessary to keep your equipment clean for everyone. But it is a service that is for and encouraged by GACHI, but for the paid patrons who go there. So I'm struggling with this a bit because it seems like there are a lot of solutions to the issue, maybe not as easy or as simple as building showers and requiring patrons who come in and are not clean enough to use the equipment to just shower. But it seems like there may be some other solutions available to you, such as just making that a requirement that they shower on their own before they come in, etc. Again, with the primary responsibility to keep the patient showers clean and devoid of people who might spread COVID or other disease. So I guess maybe I guess maybe to again try to employ the auditor's strategy here. What I'm hearing you say is that the solution for making sure that paid patrons are clean before paid, or the seniors are clean before they use the equipment, is to build more showers so that they are not using the patient showers. Do I have that right?
Are you asking me?
Yeah, I think I'm looking for some confirmation on this.
Okay, we're just not a gym like you would just go to a gym and you pay exorbitant amounts or anything. We are the only state licensed person in the state of Wyoming that's a CORF, Comprehensive Outpatient Rehabilitation Facility. In that requirement, under that licensure, we are required to give them the next level of care. And you can verify that with the court. And so when we discharge them, we just don't say you're discharged, you get to go. We discharge them with free membership downstairs and then the therapist goes downstairs with them. They treat them. That's the way we are required. We needed to, and it's not required in my outpatient facilities in Cody or of that, because they're not part of the CORF. And so we're just not a typical community Jill, that's coming in, like a YMCA or something like that. That's not who we are. But we don't want to refuse anybody in the community because we don't have another facility here of any type that anybody can work out in. And the influx has become with the pay, not only that, it's our therapists, it's our, the ranchers. I mean, they all, and the oil field workers, they do come in. And I got to tell you, a lot of them are our patients that have been discharged down there. That's probably one of our biggest rehab people are ranchers with knees and hips and all of that. So I guess I'm having difficulty trying to express that we're not a YMCA. We're not, that's not who we are. If we didn't have to discharge them to a next level of care due to our licensure, we could just be like an outpatient facility. It says, okay, you're discharged and off you go. But we even have to put that in notes, and our therapists have to put notes that they've now been trained or they're discharged to the next level of care with recommendation to continue downstairs. So it's not by any means a big gym, I guess, is what I'm trying to say.
Thank you, Mr. Chairman. That suffices.
All right, well, thank you. Is there any further question or comment? I'm not seeing any. Ms. Shera, thank you for your clarifying comments. I do see the auditor.
One just last quick question for Ms. Shero. Are all patrons required to shower before they use the wellness facility?
No, it's the ones that come in with muddy, dirty clothes and sweaty.
Thank you, Mr. Chairman.
Thank you, Madam Auditor. All right, what's the pleasure of the board? Madam Superintendent.
Mr. Chairman, I move to approve the director's recommendation on for $43,654 for showers and washers and dryers for the Gotchi Foundation. Yeah, I'll move that and just recognize that there's a lot of gray here, but there are definitely patients in and outpatients and healthcare providers who would be positively impacted by this adaptation to better respond to COVID-19.
Thank you, Madam Superintendent. Is there a second?
I'll second, Mr. Chairman.
It's been seconded by the Secretary. Thank you, Madam Auditor, for your offer as well. Is there any discussion? I would only note that a lot of the testimony here has been about sort of cleanliness of clothes and presentability of the clients, and not as much about the sanitization and so on. And I guess I think it's probably a worthy project, but I'm thinking that I would love to have seen more direct talk about the sanitization requirements of people using the wellness center. It's just my observation. Other discussion items?
Yeah, and Mr. Chairman, I think to that end, I think that I strongly recommend that during the next few months anyway, on this time of COVID, that you require everybody to shower before they or come into the gym, in a manner that or take their temperature. So try to make sure that interaction between the general public and your outpatients or any other people coming from your other health facility, that that you step it up a notch. Maybe you're already doing it, but it sounds like there's a need for the showers and stuff, but I think that there's also a need to perhaps be a little bit more diligent. Thank you, Mr. Chairman.
Thank you, Mr. Treasurer. Further discussion items? Further discussion items?
I would just like to say that we are so overprotective right now. You can't come into the facility in the front door, any side doors, or any wellness without entering the halls with a mask. And we give masks out to everyone that comes. Now, once they're in the room or once they're working out on a piece of equipment, that's very taxing, according to our medical director, due to breathing. When they're working out, that can be hard, but they are all, temperatures are taken, they're recorded, and everybody has to sign in. And we're really monitoring that, because if somebody flares up, we have to have the ability to let everybody who's in the facility that day know if anybody's infected.
Thank you.
And I appreciate what you're saying about everybody taking a shower instead of, that can become a little bit dangerous when we're pointing, you need, but you don't need. So that's very well taken. And I just want to thank all of you for consideration of us. And I would really like it if any of you are in Wyoming. I'm pretty proud of the facility. I've been the director here for 21 years. And I would welcome you to come and see us and visit us, because I'm really proud of the facility and the team that we have here. And I just want to thank you all for considering us.
Thank you, Ms. Sharrow. So the question's been called for. So all in favor of the motion to follow the director's recommendation, signify with a thumbs up or an aye. Okay, that motion carries. Thank you. All right, now we're back on to the Campbell County Courthouse modifications. Madam Director.
Yes, Mr. Chairman, before we move further into this, I just wanted to note for the board that we understand that Campbell County Health has withdrawn numbers 6, 7, and 9 today, so we will not need to consider those applications.
Thank you.
Okay, application number 2 on the recommended no funding list, Campbell County Courthouse modifications in the amount of $329,500. The applicants requested these funds to renovate the Campbell County Courthouse, to construct two large conference rooms with technology to allow the courts to conduct voir dire of jurors. The funding also includes expenses for information technology, including phones, audio, video equipment, Wi-Fi access points, a cell phone booster system, and furniture. Really, the concern with this is that Campbell County has already exceeded its allocation. To date, I think the Slib has approved $6,404,453 for Campbell County, when its allocation was $5,767,787. So currently, Campbell County is already $636,666 over their allotted amount per the new model.
Thank you, Madam Director. Any comments, any questions for the staff from the board? Mr. Treasurer.
Was there any discussion about whether or not that particular courthouse district is behind on their caseload, or anything about caseloads at all?
Mr. Chairman, Treasurer Meyer, not to my knowledge. I would defer to Mr. Peters on that if he has additional color.
Mr. Peters.
Mr. Chairman, Mr. Treasurer, not to my knowledge. either.
Yes, in general, Mr. Chairman, I had thought that most of the courts were going to defer a lot of their civil actions and just primarily work on criminal cases during this time period, and I didn't know whether there's any update on that. If they're still just looking in that regard, courthouse modifications might help alleviate that. So that's the only question I have. It'd be nice to have some new information as far as what's going on in our court system.
Mr. Chairman, Mr. Treasurer, the application does state that the 6th Judicial District resumed jury trials in August 2020, if that's helpful.
Thank you, Mr. Peters. And I'm aware that the judiciary is working on technology and other things to sort of expedite, but everything has been backed up because of COVID. So
It might be a good time for courthouse modifications if they're doing things with technology. I guess I defer to counsel over there.
Mr. Secretary.
Well, thank you, Mr. Treasurer. It looks like what they want these funds for are to construct conference rooms in the basement so that they can have what's called a veneer, which would be the jury pool, basically, and they could socially distance. So, like, they'd stuff them in a big room. Well, stuff them is not the right. Not social distancing.
Strike that.
But a big enough room so that they could maintain distance. They talked a little bit about some new technology where you could do something remote, but that's not what they're talking about here, so I guess it just depends. But that's what it looks like it's about, is making a bigger space to put people in so that they can be 6 feet apart or all wear masks, I guess.
Sure. Thank you. Further questions? Further questions? Is there anyone from Campbell County that would like to address the board? I have Ms. Seeger.
Good morning, Mr. Chairman and members of the board. One request I have is, as what's been discussed earlier, when we started out, the grant funds were going to be distributed, by applications only. And then at that time, there was Treasury guidance sent to all the counties that focused on payroll expense. And Campbell County.
Ms. Seeger, I'm wondering if there's a way you can approach your microphone a little closer. It's a little hard to understand your commentary.
Is that better?
I think it's a little better, yes.
And so Campbell County followed suit with that and submitted the payroll expense. One suggestion I have is rather than deny this application, you approved the previous application for the $6 million in payroll expense. It remains to be seen if, we just got the form and the contract will be in front of the commissioners tomorrow. But it remains to be seen that we would get our allocated amount of $5 million through reimbursement payroll expense. So I'm wondering if the better course is to, if it otherwise qualifies, is to approve our application, recognizing that we can't exceed our allocation of $5 million. Does that make sense?
Mr. Secretary.
If I understand correctly, what you're saying is that you've got a pending application for payroll, but you don't know if it's approved, so we would offset that amount by this amount, and that would be appropriate because you may or may not get all of your requests for the payroll. But am I incorrect in saying we already approved that? And for what reason would that be denied?
Well, you did. We submitted an application, and the 6 million was approved, that application, but we haven't submitted the reimbursements and had them honored yet. I mean, there are requirements to get that reimbursed. And for instance, I'll just say our application was for payroll expenses through December 30th, and that won't be possible with the December 15th cutoff. So I'm just suggesting, since it's an unknown whether we will have that payroll expense actually reimbursed despite approval of the application itself, if it might be wise to not deny this application that qualified. I mean, we understand and we'll live with the maximum amount we can receive. I would just hate to lose out on this opportunity to construct those rooms, and then not get all of the $5-some million that's been allocated.
Okay, thank you. Mr. Secretary, you have any follow-up? Treasurer is on deck.
Yeah, Mr. Chairman, I'm thinking what they're asking for is just an authorization of funds that are already allocated to be authorized for the purposes of courthouse modifications and not to exceed the amount of funds authorized.
Mr. Chairman, if I might make a suggestion, if this is the path that they would like to go down, perhaps they would consider relinquishing some of the approved funds that the board has already provided for payroll, and then bring this application back to the October meeting for further consideration when it could open up a window of funding, if you will.
Thank you, Madam Director. I think it's a good suggestion. I'm wondering, Ms. Seeger, what your comments are on that.
Well, my only concern is it's construction, and my public works people are already telling me that it will be tight. It's a very tight schedule as it is. So, yeah, I mean, I will totally respect whatever your decision is. I'm just pointing out some of the challenges communities are facing, you know, with how to manage the request and requests we're putting in for funds and how those funds are going to be used. So I was just suggesting that if a project that communities come up with otherwise qualify, to approve them and not let anyone expend beyond, or, well, not, I mean, obviously you can waive from that, but let communities understand that they may be, you know, they're held to that minimum. And I'm sorry, I'm not being very articulate about it, but.
Yeah, so one quick question that I have, the Supreme Court has asked for funds specifically for voir dire. And are you familiar with that, or are you already engaged if you are looking at using those funds for these purposes?
Mr. Chairman, members of the board, I am aware that the Wyoming Supreme Court got COVID funds and they've been doing technology upgrades, and we have been one of those counties. The real challenge we have is that, of course, our courthouse and the rooms, our spaces, are for sizes that were pre-COVID. And while we resumed jury trials, like say our jury deliberation rooms are very, very tiny. They can't deliberate in there and socially distance. Yeah, and like when you bring in the panel for voir dire, the court with spacing, The rooms aren't big enough, so we've been utilizing a meeting space across the hall in a building we have across the way, and we're just short on spaces that are large enough to accommodate both jury trials and other types of meetings with the new spacing requirements.
Thank you. Mr. Treasurer.
Yeah, Mr. Chairman, I think I could get a motion that's easy enough to understand and would provide for the courthouse modification dollars. That essentially it would just say the previously allocated funds for payroll are reduced by $329,500 and reallocated to courthouse modifications.
Mr. Chairman, if I might, we currently already have an executed grant agreement for the full amount, so I think there would probably need to be some paperwork on our end before funds would be awarded for this project anyway.
Thank you, Madam Director. Beth, do you had any more?
I would agree with the director. I think the cleanest, most direct route would be for the county to submit a relinquishment letter. We can then adjust that grant on our internal accounting system. This application could be tabled today, reconsidered at the October 1st meeting.
It's construction. They say they might not be able to do it if they wait 2 weeks. I don't know if that's true. That's their concern. So,
Mr. Chairman, just if I might, these are...
I'd have to do more paperwork, I guess.
Mr. Chairman, there's nothing that would prevent them from moving forward with their project. That's kind of the beauty of the allocation method. It is a reimbursement program. So I don't know if that's a consideration for the board or not.
Thank you for that clarification, Madam Director. I see the superintendent has her hand raised.
Yeah, thank you, Mr. Chairman, and thank you, Mr. Treasurer, for putting a potential motion forward. I'm inclined to maybe just see if we could add, I am very sensitive to the timeline that all of the entities are under, and 2 weeks in construction time could be a lot. And to have that assurance that the funds will be approved through a motion today might give them some peace of mind in moving forward. I wonder if we could make the relinquishment and the paperwork part of the motions. So, just adding to the treasurer's motion, perhaps we could just include some provision that all necessary paperwork to shift funds or relinquish will be done, because that seems more like an office function versus a board function. And granted, it is paperwork, but maybe there's just a way that we can give them the formal nod to move forward today, and also hold Campbell County accountable to making sure that the paperwork to relinquish the grant agreement that's in place is on the rail as well.
Okay, and that the treasurer has indicated it makes sense. My question on this is there really is nothing, to the director's point, there's nothing holding them back from doing this. There actually is funding potentially from the Supreme Court to additionally do this. And I'm just wondering timing, to the point that the secretary made earlier, who do we take this away from if we're going to exceed the allocation model? And I understand that the intent of the motion is to not exceed that allocation, but I think the amount that's recommended still leaves us in well over the top, if I'm correct.
Mr. Chairman, that's correct. The one other concern that I have, and maybe Mr. Peters knows this, is I'm not sure who specifically signed off on the previous payroll application for the county, so I don't know if all aspects of the county are communicating on their funding here or not, So I would be concerned if the county isn't fully on board with the request that's made here today. I just don't know the answer to that, and maybe Mr. Peters does.
And I see Ms. Seeger has her hand up, but before she speaks, you know, I think that's one of the concerns I have. If we've passed something and then we're going to come back and then modify it, I guess I'm a little worried about that course of action. But Ms. Seeger.
Mr. Chairman and members of the board, the county is fully communicating on this, so we're aware of this. And I just want to make sure that staff knows we did get the grant agreement awarding the $6 million in payroll costs. And as I indicated earlier, that's actually not been approved yet by the county. It is on the county commissioner's agenda for tomorrow at their meeting. So if you'd like us to reduce the grant agreement amount by that dollar amount of the construction, we can certainly do that.
Mr. Chairman?
Mr. Treasurer.
You know, I think the suggestion of the superintendent, you know, and it contemplates all of the paperwork being finished, and if the county, for whatever reason, doesn't follow through with their end of the deal, we're taking it out of the Campbell's. We're just they're asking us to reprioritize the allocation that they have now to this purpose, being above the payroll reimbursement. So to me, it doesn't make a lot of sense because it's just $1 trading other dollars. I think that if they had the payroll dollars, that would free up these dollars and necessarily wouldn't require us to do anything, but they're asking us to do it this way. I'm fine with doing it this way. It would just, but the paperwork would have to be done, and if they didn't sign off on it, then you know, this money would not be reimbursed. So,
Mr. Treasurer, if I understand correctly, should the payroll issue come up and people said in December, you okayed all of this, and we were saying this motion actually preempted all of that.
only if they agree with it and the paperwork comes in, then that would be the, you know, the caveat there that this wouldn't happen unless
So this then requires the county to sign off on a reduction of the payroll reimbursement.
Exactly.
In anticipation of this. Okay. Further comments, Mr. Secretary?
Just one quick question to clarify. So when you say they were over their allocated amount, it's not from a different amount than the payroll, was it? I was trying to find that. You know how we had the several silos of money.
Just about every category. They're good at grantsmanship.
Mr. Chairman, Mr. Secretary, I believe the only other application we've received directly from Campbell County is the $6 million related to their payroll. The rest of the Campbell County items, we have Campbell County Public Land Board, which is on your agenda, I believe, today. And then we have Campbell County Health, but I believe those are the only Campbell County applications that we have received. So the $6 million that's been awarded to Campbell County would be related to that payroll request.
Mr. Chairman.
Yes.
And I may be looking at the wrong one, but I'm looking at the spreadsheet we had. Their total allocation, 5.767 million. That's a different, I'm trying to refresh my memory on the different tranches of money.
We got rid of the tranches.
Well, that's the question. You said 6 million, this allocation, and hopefully I'm looking at the right PDF here, it was 5.7.
Could have been the original prior.
This is off the website. Let me look and see if this is up to date.
I believe their allocation should be $6,876,616.51. Maybe they're,
I'm looking at the attachment of
Okay.
J1 from our August 27th meeting, so if that's under the county CARES Act county allocation.
I think you are correct. I think it's $5,767,787. Is that the number you got?
Yeah, and we have the attorney.
Mr. Chair, Mr. Secretary, so I believe what happened is prior to the allocation method, Campbell County came in with their payroll request. That was approved. It was already a higher number than what they had been allocated. So Campbell County is already over allocated. This would be a further over allocation. This is one of the problems with them also going back on their payroll, because it's not just enough for them to say, well, we'll take $320 some odd dollars off of our payroll, because they're already over allocated on their payroll as well.
That answers my question perfectly.
Okay.
Yeah, thank you.
That was I guess the point I was making a little bit earlier, so. All right, well, what's the pleasure of the board? I think, Madam Auditor.
Mr. Chairman, just one more point, as a question by the treasurer. And the 6th Judicial District, at least in terms of district court, I believe is the, again, this information is from the prior year, so it's somewhat in the rearview mirror, but they are at the most deficit in terms of judges and workloads. So that may not matter on the surface, because we need safe courtrooms and courthouses and jury rooms regardless of how busy the court is. But what I would comment is it will be substantially harder for that district to catch up than it might be. It will be challenging to all of them, but I think they're starting out at more of a deficit to catch up.
And Madam Auditor, to that point, I guess space is obviously one issue, but also judges and other assets to the court system.
Indeed, Mr. Chairman.
Yeah, thanks. So by my math, if I understand this correctly, it reduces the payroll request, this particular motion, and I believe that motion is moved and seconded. Is that correct? Or has it been moved and seconded?
It was moved.
It has not been moved and seconded. Okay, thank you. Yeah, Mr. Secretary.
I just want to clarify one thing, and this is, I think, what Ms. Monger was saying. So they were over by $232,000 already.
No, by $636,666, I believe.
I just took what they were allocated, 6 million minus that. But if you, maybe this is the next part of this, is then you add this to it. It's not just a simple matter of offsetting it by the $329,000, because they were already underwater essentially by.
Right. By my math, if this reduces the payroll and it's a wash on that, you're still at 630. Yeah. Okay. But now, if you were to voluntarily reduce your payroll request by the amount corresponding to this and reduce the whole thing, you'd still be 200,000 over the top.
Yeah, Mr. Chairman, it doesn't do anything with the amount that we've already approved.
It's just allowing them to reallocate.
Yeah, it's just a reprioritization.
Okay. Yeah. All right.
And so I think, I don't know, it gets I make that motion, Mr. Chairman, and if there's a second, there's a second, and
So just,
go from there.
just for clarity and making sure the record is absolutely clear on this, can you state the motion?
Certainly. The motion is to reduce the payroll portion that has been previously allocated to Campbell County by $329,500, and that the appropriate paperwork be produced and finalized, and that 329.5 be reallocated to courthouse modifications. And I think that's what it is. And it's essentially the suggestions of the secretary modifying my original motion.
Okay, Mr. Secretary, what are those
Oh, no,
modifications?
excuse me, not the secretary, the superintendent.
Okay, okay.
Sorry.
So
Sorry,
the
Judge.
superintendent wanted to second this, and your modifications, Madam Superintendent, are?
The modifications are just that paperwork is completed, but I think that the treasurer's motion covers that.
Yeah.
Okay, and just so I understand, under the rubric of appropriate paperwork, that's also an understanding from Campbell County, they are relinquishing that out of their payroll. And that would be specifically required.
Yeah. Mr. Chairman, that would likely require an amended grant agreement to specify that.
So that I just wanted to make sure that was included in the appropriate paperwork. Okay, further discussion. That motion's been moved and seconded. Is there discussion? Further discussion? Any further discussion? Okay, all in favor of the motion signify with an aye or a thumbs up.
Aye.
That carries 4 ayes vote against it. So, thank you. Next matter?
Mr. Chairman, next on the list for recommended for no funding is Sweetwater County Entertainment and Craft Supplies in the amount of $8,819. Let's see here. The applicant requested actually $139,898 in funds to reimburse it for equipment and supplies and expenses related to quarantining individuals. $131,079 of that was recommended for funding. However, $8,819 is recommended not to be funded. Specifically, these items not to be funded include chairs, radios, and entertainment and craft supplies. The question of staff is a concern with necessity. The applicant did provide a list of the items that it sought reimbursement for, but again, it's unclear whether the craft items and the entertainment are in fact necessary to address the COVID-19 pandemic. Specifically, the reimbursements that staff have questioned are the 12 vinyl chairs, the radios, candy for morale, dye, planting, kids prizes, and that's the recommendation.
Thank you. Any discussion? Any questions for the staff from the board? Is there anyone from Sweetwater County who would like to address the board? I see Ms. Marshall.
Good morning, Mr. Chairman and members of the board. My name is Christina Marshall. I'm the Sweetwater County Grants Manager. And you will be happy to know right off the bat, we accept the no fund recommendation. So we will not be spending a half an hour debating this. However, I did want to point out a couple items. First of all, Sweetwater County sponsored this grant application for Southwest Counseling Service. And I want to put to the forefront that they are a community mental health and substance abuse, or excuse me, substance use disorder treatment center. Of the 7 entities allocated funding in the allocation model, or the types of entities, mental health was actually not addressed. And so I just wanted to let you know we appreciate your support of the first part of the application, which was about 95% of the request. As a sponsor, we actually did question these expenses and appreciate the Office of State Lands Office for vetting it out with us. As you all know, it's been hard determining what is allowable. In your packet, it is somewhat misleading as entertainment and craft supplies. So for the benefit of the public, I just wanted to emphasize this is for our group homes, for residential and transitional beds for the clients. So we are not arguing, we're not requesting your approval of this funding, but I wanted to make it clear, it's, excuse me, it's not for like a PlayStation in my office. So anyhow, we appreciate your support of Sweetwater County. We are treating our allocation under the model, kind of like a consensus model, where we are happy to sponsor applications for entities not under the formal designation. So with that, I would be happy to answer any questions.
Thank you, Ms. Marshall. Are there any questions for Ms. Marshall? I don't see any. I want to thank you for addressing the board. So what's the pleasure of the board? The treasurer has moved the director's recommendation. Is there a second? Is there a second?
Second, Mr. Chairman.
It's been seconded by the auditor. Is there any discussion? Any discussion? Any discussion? If not, all in favor signify by saying aye or a thumbs up. Aye. That motion carries. Thank you.
Mr. Chairman, the next item on the recommended no funding list is the City of Cody sanitizing equipment and technology. The City of Cody requested $2,600,546, but has only been allocated $1,662,780. The application was for funding payroll expenses, telework technology, PP&E, and sanitizing equipment. Because $492,609 was on the fund list today, and $1,170,171 on the payroll list was approved, the City of Cody has been awarded funding up to its allocation. So this amount, the $937,766, would be in excess of the allocation, and that's why it's on the no fund list.
Thank you, Madam Director. Any questions for staff? Any questions for staff? I see we have Leslie Brummage online. Leslie, would you like to address the board? You may be muted, and it looks like you're muted on your. And we can't hear you if you are talking. Maybe your computer is muted. Leslie, you were on and now you're not.
Mr. Chairman, I'm trying to promote her to a panelist to be able to speak. So please,
Okay.
Leslie, keep trying.
Oh, there, she is there promoted. Mr. Bump, is Leslie?
Mr. Chairman, appears to be having technical difficulties getting that microphone to work. Leslie, you may want to try to call in using the phone numbers in your invite. We are not able to hear you.
She is, I have a message from Leslie on the. Give it just a little bit more. Leslie, I'm hoping you're able to call in. Leslie is attempting to call.
Can you hear me?
Yes, we can. Thank you.
Oh, good. Thank you. Well, thank you, Chairman and board members. We appreciate the opportunity to attend your meeting and speak with you today. When we initially submitted our application, it was right about the time that the board had decided to move towards an allocation method rather than a first come, first served method. So when we submitted it, we were aware the $2.6 million application was over our allocated amount, so we were expecting to have some funds that were not approved. I would like to ask, can you tell me, were there specific items that were not approved, or was it just the amount that was reduced and it's left up to us how to allocate it amongst the items we requested?
Madam Director.
Mr. Chairman, I would defer to Mr. Peters.
Mr. Chairman, to answer the question, based on the priority list that the city of Cody submitted, staff and myself went through and tried to figure out everything that we thought was clearly eligible to fund, and that amount was put on the fund list. Of the priority 1 and priority 2 items, the only 2 items that were not included in that list was the automated meter reading system and the advanced automated meter solution amounts. So to offset that, the remaining amount of the allocation was put under the payroll category.
Thank you. That's what I thought had occurred, but I just wanted to confirm that. So we're not going to spend a lot of time questioning anything. The City of Cody agrees with the amount that you have awarded, and we certainly appreciate your consideration.
Well, thank you very much, Ms. Brumage. Any questions? Any further questions from Ms. Brumage? Hearing none, what's the pleasure of the board?
Director's rec, Mr. Chairman.
Treasurer moves the director's recommendation. Is there a second? It's been seconded by the superintendent. Any discussion? Any discussion? One question I would have, I guess, Madam Director or Ms. Blackwell, on the payroll pieces of these sorts of things, if we get to the end and there's a sweep, will there be the opportunity to think about, and that is indeed so. Okay.
Yes.
Very good. With that, one more call for discussion. Seeing none, all in favor signify with a thumbs up or an aye. That motion carries. Next message, or next.
Mr. Chairman, the next item on the recommended for no funding list is Campbell County Public Land Board. They have requested $100,000 for branding and remarketing of the Camplex multi-event facility. The expenditures would include advertising, a videographer, print materials, social distancing measures, PP&E, and other cleaning and sanitizing supplies. As we've mentioned, Campbell County has already exceeded its allocation. Currently, Campbell County is $636,666 over their allocated amount.
Thanks. Any questions for the staff from the board? Hearing none, is there anyone wanting to address the board from Campbell County Public Lands Board? I'm not seeing any, Mr. Bump. I'm showing up. What's the pleasure of the board? So the treasurer moves the director's recommendation again. It's been seconded by the secretary. Is there any discussion? All in favor signify by saying aye or a thumbs up. That motion carries. Next matter.
Mr. Chairman, as I noted, numbers 6, 7, and 9 have been withdrawn. So the last item for consideration on the no funding list is Campbell County Health, number 8, their legacy enhancements. Campbell County Hospital District, as we noted, they have the 4 separate allocations. When they're combined, Campbell County Health has exceeded its total allocation by $1,015,569. If, however, the board does not combine the 4 separate allocations, Campbell County Hospital District, doing business as Legacy Living and Rehab Mission, has $683,555 of its allocation remaining. And this application, let's see, it's for, you'll see in the in your materials that there is a table of the items for which they are seeking funding. There are some concerns by the staff as to whether or not some of these are necessity and meet the necessity requirement. So the highlighted items would be what the staff would consider consistent with other items that you have funded, such as, I believe the ones the staff agrees with are the infrared thermometers, the plexiglass around the reception desk, and the bipolar ionization. Oh, okay. And excuse me, but Ms. Blackwell has indicated to me that this one was was under consideration by the board previously at the last meeting, so it will need to be untabled.
Okay, I had forgotten that, thank you.
Moved, Mr. Chairman.
So I'm sorry, Superintendent, you moved to have it brought back on for consideration, is that correct?
Yes.
Okay, thank you. Is there a second? Second. It's been seconded by the treasurer. All in favor signify by saying aye or a thumbs up. Okay, then it's back before us. Thank you. Any questions for the staff? Any questions for the staff? Any questions? Thank you, Madam Director. Good job. I see Mr. Boley. Mr. Boley, would you like to address the board? And then I see Mary Lou Tate.
Mr. Chairman, if it's all right, maybe I could allow Mary Lou to go first, and then I could add comments afterwards, if that's okay with you, or I can address it now, whatever you prefer.
Very good. Ms. Tate.
Yes, thank you. As was stated before, this was tabled from last meeting. We did apply prior to the allocation method change, and the previous awards given, the hospital did receive more than the subsequent allocation amount. And we are asking that we consider this legacy, which is our long-term care center. It currently has 141 residents in it. We ask that this is funded separately from the hospital. The remaining allocation left for the legacy is $683,555, as previously stated. I'm more than happy to go through the items and how these directly relate to COVID. The residents of this facility have been quarantined in the facility since March 12th, thereabout, with no in-person visitation since that time. For a short while, we did have fence visits with family members. However, none of the residents have been able to hold, hug, or have physical contact with their loved ones for almost 6 months now. The quality of life of these residents, due to not having that external contact, has diminished. Many of these items are either directly related to the care of the patients. The top probably quarter of the application is all items directly related to the health and the care of the patients. And the latter part is more of the quality of life items. These residents have not been able to go out to public events. They have not been able to partake in other items in the community. And so a lot of these are to help lift the morale directly related to the COVID lockdowns for the long-term care centers.
Thank you, Ms. Tate. Any questions for Ms. Tate from the board? Madam Auditor?
Mr. Chairman, Ms. Tate, thank you for being here. Now, just so sorry, I'm trying to think through if this is an appropriate question or not, but I guess my question is, you're obviously dealing in a COVID environment. Have you had situations where specific residents have had to be quarantined or isolated, or just sort of the general everyone is somewhat isolated?
Thank you for the question, Auditor. We've had both. The residents in general are quarantined from the public. However, any resident that comes into the facility is under quarantine for 14 days upon admission. If they show signs or symptoms, they are entered into quarantine. By regulations, for a while, we were testing residents every week to see if they were COVID positive. Staff are tested either weekly or biweekly, depending on the COVID-19 incident rate in Campbell County. So we have had both, where a patient is directly quarantined, but then also the general quarantine of the facility.
Thank you for that clarification.
Thank you. Further questions? Further questions? Mr. Boley.
Thank you, Mr. Chairman, committee members. So this is an interesting one. And again, I go back to the fact that we've kind of changed the rules midstream here. the nursing home has not applied in the past. And if we're gonna accumulate all the totals, we're going to probably damage healthcare in our state. We agreed to the allocation methodology in an attempt to be good partners, in an attempt to help expedite this. But this is one great example. Long-term care facilities in our state are really struggling, not so much with treating COVID patients as they come in, but keeping COVID out. And as you have seen around the state, when COVID gets in, it's absolutely deadly. And that's where 80% of the deaths have taken place in our country is in our elderly population. I would just encourage you and ask you to consider this application separately, realizing that when the original applications came in, there was no allocation model in place. And some of these applications take time to put together, realizing what their needs are and how it's going to impact and what's going to be necessary to treat and care for these COVID circumstances. So I would encourage you to take a close look at this project and hopefully fund it so that we can take care of those residents in the legacy, and also kind of have a plan moving forward as we take a look at other long-term care facilities around the state. Thank you.
Thank you, Mr. Boley. Any questions for Mr. Boley? Any questions? Hearing none, what's the pleasure of the board?
Mr. Chairman,
Madam Auditor.
I apologize in advance because I don't necessarily have a solution coming out of this, but I think I want to keep these separate. And I think that's in comportment with what we've done already today. However, I'm uncomfortable approving up to their allocation because I see a lot of the items listed out. And thank you, Ms. Tate, for listing these out. That's very helpful to us. But within that list, I see items that are obviously related to COVID. I see items that we have consistently denied on other applications and therefore I think should be denied. And then I see items that I think could go either way. So that's my concern, is how can we delve in more and figure out the right amount? Like, for example, the painting and craft supplies, while I think we fully understand how critical the need is there, those don't comport with CARES Act. However, there's obviously things on here that would. So I guess my question is, what's the best way to get there if anyone else is feeling similarly?
Thank you, Auditor Racinas. Mr. Secretary, do I see you?
Mr. Chairman?
Mr. Treasurer.
Yeah, I agree with the auditor. There are a couple places I think that I would probably cut is the HVAC covers for the generator systems. That's 20 grand. ADA transport golf carts. I'm not sure how many golf carts that is, but I think that's probably a whole fleet of golf carts. I'm not sure what the access points for legacy is, whether that's a modification of and how many modifications of access points. They bounced this up to 717,000 and their cap is 683.
So, Mr. Treasurer, I think I really appreciate what you're doing. I do think that Ms. Tate offered to walk through the list.
Let's do that, Mr. Chairman.
Ms. Tate?
Yes, Chairman. Would you like me to start at the top and just talk to you about each item and how they relate to COVID?
Yeah, so, and if this is okay, what I'd like to do is read down through what I have on our list and see if there's anything missing, just to start with.
Okay.
And I'll just tick off what we've got. Digital stethoscope, infrared thermometers, vital signs, towers and cuffs, Microsoft Surface laptops and covers, iPad and rolling carts for clinical documentation, plexiglass around receptionist desk and nursing stations, Hellos Plus H300 portable oxygen units, Panacea Pulse Air Max pump air mattress bariatric, wheelchair cushions, designated housekeeping cart for COVID unit, isolation garbage cans, isolation hanging bags, personal hygiene station, Windsor Karcher Chariot 2 IVAC 24-inch vacuum, covers for HVAC and generator systems to prevent damage, dishwashers, visiting booth, hearing amplifiers, ADA transport golf carts, outdoor sound system, virtual reality system, Kindle Fire 8, mobile activity cart for one-to-one activities to supplies, painting, craft, recreation supplies, access points for legacy, bipolar ionization, legacy, and video conferencing. That's our list. Am I missing anything on that list?
I also had hooks in the amount of $480.
Oh, hooks on the very top. Yeah. Thank you very much.
All right.
Okay, so let's walk through that.
Okay, thank you, Mr. Chairman. So starting at the top, the hooks are necessary. We have designated PPE for various residence rooms. So each of the rooms are either single resident or there's a couple that are double resident for married spouses to occupy the same room. Otherwise, they're all private rooms. So these hooks would go on the door where the nursing or CNA staff could hang the PPE for that room. So we do not cross-contaminate reusable PPE. The second item, the digital stethoscopes. These are stethoscopes that are digital to prevent the caregiver, as of right now, when you're taking blood pressure or listening to heart sounds, you have the stethoscope and you're very close to that patient. These are digital stethoscopes where they displayed the results of the heartbeat, so the caretaker is not in close proximity to the patient. This is especially important for COVID rollouts or patients on isolation. We want to maintain that social distancing. Infrared thermometers, we now have to take patient temps multiple times a day, wherein before it was just as needed. So for 141 residents, we do not have enough thermometers. So this is buying 10 more thermometers so we can continue taking patient temps. I believe they're doing it twice a day right now. Vital sign towers and cuffs, once again, before we were taking vital signs just as needed. If someone was feeling ill or their doctor asked for regular readings. Now we must take these vital signs of every resident a couple times a day. So once again, we're needing additional units because we do not have enough to take the vital signs of 141 patients. The Surface laptops and covers, as well as the iPads and rolling carts for clinical documentation, they're both kind of similar. We currently we have a centralized model with a nurse's station in one location in each of the different units within our long-term care center. With COVID, we're having to document inside patient rooms now. And so, especially if they're under isolation. And so these items, some of them are to be used going room to room, and other ones, if a patient's in isolation, is to allow the computer or iPad to be left in that patient's room while they're under isolation, so we're not cross-contaminating. But they're used for documenting the patient's vital signs as well when they're using those towers and cuffs that were previously recommended. Once again, because this is more of a family-oriented environment, our reception desks and nurses stations are open air, and patients and residents frequently congregate around their nurses stations or the reception desk. And so in order to allow for some social distancing for our staff, we need to install plexiglass around those items. So even if the resident's right there next to them, there is some separation between the staff and the resident. The portable oxygen units, we're needing some additional units. We're having more and more patients coming into the legacy with oxygen needs. Many of the studies have shown that people coming out of COVID do have additional oxygen needs, but this is to help supplement the fleet that we currently have, because more and more of our patients are requiring oxygen needs. And as patients that are residents that are currently in the facility decline because of isolation and depression, more of them are going on to oxygen. And so this is to help support their oxygen needs there at Legacy. Once again, these are portable units, so that way they can take them around if they wanted to go down to the main area or go outside, they'd be able to take the oxygen with them. The bariatric mattresses is the Air Max pump air. These mattresses are formulated to prevent pressure ulcers in patients, and we are needing additional mattresses because as we do isolate the incoming patients, they're in their bed more frequently than what they have been in the past. And so we are needing additional mattresses to prevent pressure ulcers for patients that are confined to their bedrooms or their resident rooms for a long extended time. The wheelchair cushions similarly are specially designed cushions. It's for 35 cushions. They are formulated to prevent pressure ulcers. We're finding that our residents, with not being able to be out in the public and visit with family, they're tending to stay in their wheelchairs longer periods of time. And we want to make sure that we prevent them from obtaining pressure ulcers. Once again, they're not out and about as much, and so they're not getting out of their wheelchairs as much since COVID has hit. The house cleaning cart, isolation garbage cans, isolation hanging bags, and personal hygiene stations are all interrelated. Once again, these are for those isolation areas. The garbage cans, hanging bags, and hygiene stations are specific to rooms within the isolation unit that we can put them on those doors or within those rooms to prevent having to carry items in and out of the rooms as they're needed, but rather they're there for when patients are in isolation due to COVID. It's all essentially maintained on those doors. The housekeeping carts would be specific to that unit, so that way we would not take the housekeeping carts out of that unit. That is for 2 carts, and then that way we can keep those carts in that unit and not taking those carts out and exposing the rest of the residents to the COVID from those isolation units that we have. That vacuum, it's 1 vacuum for $11,200. That once again is a vacuum specifically to keep it within the COVID unit. Most of the materials in the patient rooms that we have carpet in the hallways and in some of the patient rooms. And so that's a dedicated vacuum to keep in the COVID unit so we can maintain the cleanliness of the patient rooms and the hallways without cross-contaminating the whole Legacy with COVID. The covers for HVAC and generators, I thank you, Mr. Treasurer, for pointing that out. What this is we currently have HVAC and generator systems for backup. However, there's been twice in the last couple of years where we've had hail damage and it's decommissioned those units, and we've had to wait to put in additional units to have air conditioning or heat. The problem that we have right now with having to isolate our residents is we have nowhere to put those residents if one of these units is out of commission due to hail damage. In the past, families have taken their residents home for a day or two while we get things replaced. We obviously cannot do that due to COVID, and so we were requesting the $20,000 to protect those units because we would not be able to place the residents somewhere else if AC or heat goes out. The dishwashers, because of COVID, we typically do communal dining where the residents come to the dining room and we plate their food in front of them. They say what they like and then they sit at the table and eat. Because of COVID, patients have to dine in their room, and due to regulations, we have to separate out each of the items. So if they have a hot item and then a cold item, they can't be on the same plate. And so we're using additional dishes, probably 2 to 3 times as many dishes per meal per resident. And so we're needing additional dishwashers to keep up with that load. Right now, we're barely keeping up to clean dishes from breakfast to have dishes ready for lunchtime. And so these dishwashers will allow us to wash those dishes. They're a little bit bigger of a unit, will allow us to wash the dishes longer and have a quicker turnaround time. And these ones also have a higher temperature setting. And so to help kill any COVID, if there were any on the dishes. The visiting booth is a external unit that we're building. I know last time you guys had discussed this for a couple other long-term care centers, but this is a booth that we can allow the family members to be on one side with plexiglass in the middle and the resident on the other side. So they continue having visits out of the weather during the winter season. Right now, the only visits that we can have with residents and family is what we call window visits. And that's where a family member is on the external side on a cell phone and the resident is on the inside on a cell phone, and they're visiting through the window. Obviously, with the winter season coming upon us, we can't ask the family members to stand outside in the cold. And so this is a visiting booth that would allow residents to continue to have visits with their family members. The hearing amplifiers, this is for 50 sets of hearing amplifiers because two reasons. Number one, many of the residents are hard of hearing, they're older in age, and these are amplifiers that would allow them to hear better on cell phones when they're having window visits, or if fence visits are ever implemented. Again, the resident and their family member are 6 feet apart on opposite sides of a fence. Each of them are 3 feet away from the fence. And so the residents have a very hard time hearing their loved ones in person. And these hearing amplifiers are used to help amplify the sounds in the air, so that way the residents can actually hear their loved ones. The 88 transport golf carts, this is for 2 golf carts. We have the luxury of the long-term care center being next to a park and a very nice cemetery here in Gillette. The problem is with the staffing that long-term care centers have, we cannot afford to have a one-to-one transport. So taking one person out of the facility, pushing the resident around the park or the cemetery, and then coming back, that the cemetery is on a large hill. And for the safety of the resident, we do not want the staff member pushing the resident back down the hill to come back to the facility. So these are actually golf carts that are ADA compliant, meaning that we can wheel up to 2 wheelchairs onto the back of a golf cart. And then we can drive the residents around to allow them some fresh air, a little bit of scenery, rather than being confined to the building. Like I said, right now we don't have the staff readily available, but if we could put 2 residents in the cart and drive them around for 15-20 minutes and allow them that time, and then like I said, the safety factor that we have with the cemetery and all the hills around us. The outdoor sound system, once again, like I said, we do have that park outside of our facility, and we have some musicians that have come to play for the residents to help lift their spirits and give them a little bit of entertainment. Unfortunately, because they are on the opposite side of the fence, many residents can't hear the drums playing or the guitar because we don't have a sound system. So this sound system is necessary, once again, for the quality of life of the residents due to COVID, to have some enjoyable entertainment. The virtual reality system, once again, is because the patients cannot leave the building due to COVID. The virtual reality system allows us to take the residents on a trip virtually in a, hopefully all of you have seen a virtual reality system. So we can have them visit Paris. We can have them go to the woods. We can even have them go to a rodeo with a virtual reality system. Once again, this is due to quality of life. Many of our residents are becoming depressed, and depression studies have shown have led to failure to thrive, which then leads to death of our residents. And that is what we're trying to prevent due to the fact that our residents cannot have family visitation and they can't go out into the community or have, you know, vacations or anything like that. The Kindle fires, once again, are used for residents for mental health projects. They can go in and do puzzles on Kindle fires. They can read books. There's a lot of different activities that the residents can do on those, once again, to help entertain them and keep their minds from wandering and becoming too depressed from the fact that they're isolated from family and friends during COVID. The mobile activity for supplies and then the supply items themselves, painting, craft, recreation, I'll address those together. Once again, because many of our residents are confined to their rooms, if they're in isolation, that cart is necessary to take activity supplies to their rooms. One thing that you guys not be aware of is we do have to have by regulation an activity program for the residents, and because the residents are not able to leave the facility, they are not able to have visitations with loved ones. We are going through our recreational supplies much faster than we normally use. Like I said, it is a regulation that the long-term care facilities have to have activities and recreational items for residents. So since we're going through those much faster because the residents are contained because of COVID, that's why we're requesting the additional crafting items, and then also a cart to take craft items into patient rooms that are in isolation. Down to the access points for Legacy. The Legacy is a very large building, and these are IT access points to allow the connection of tablets, cell phones, other electronic devices to the network. We currently do not have enough access points. We have system failures there quite often right now because of the number of devices trying to connect to the network. So we do need additional access points. Like I said, because of COVID, we're using more cell phone devices in that unit. We've set up FaceTime with residents and their families, but because we're having so much higher usage of cell phones and electronic devices, many times we can't connect to the system because it's getting overloaded, so we're needing to add access points. The bipolar ionization system is an HVA system. I know you guys have seen many of these come through already, but once again, this is to help purify the air for the Legacy building. I'll answer any questions if you have any specifics around that. And then finally, the video conferencing is both for staff and for residents. Right now, we do not have any rooms in the Legacy that we can do a video conference in a large scale. So our staff do not leave the Legacy when they start their shift. Normally they come over to the hospital for meetings or different events for staff. Because the staff cannot leave the Legacy, we need to video conference them into various meetings. We can also use this in times of distress that they can call over here. We can have a video conference. We can also use this video conferencing for the residents if we are trying to put on an event where the staff can't go over to Legacy. One thing you might not realize is the hospital staff are not able to access the Legacy right now because we're trying to keep the patients safe over there, our residents. And so if you're working at the main facility, we cannot go over to the Legacy and interact with the staff at Legacy. And so we're trying to add that video conferencing capability for that location. Any specific questions that you guys have?
No, thank you very much for going through that. Appreciate it. So, Mr. Treasurer.
Well, from my perspective, I guess it isn't payroll, so it's something that can't really be, I guess, split up easy later on. So I don't mind giving them the $683,555. I think they're going to have to either, if they want to spend more, they're going to have to come up with it. But I don't feel a little uncomfortable going over the 683 because that is the allocation cap on that.
Okay, thank you. Mr. Secretary.
Just to
a point for discussion based on my earlier comments a couple hours ago. So they're over their allocation in large part, if not 100%, because of the grants we've awarded to the hospital and the hospital district. According to our spreadsheet, this is a separate allocation. There's a lot of different ways you can look at this, but there's the hospitals we had, and they're clearly over for hospitals. But this legacy falls under a long-term care facility. And according to, I guess this is part of a question, of the, is it $800,000 that we allocated to them under the long-term care facility? What did they have out of that from previous? Or is that the same amount?
Mr. Chairman, Mr. Secretary, if you take just the $800,000 that was allocated to the center, they have $683,555 left.
So that's the number that the treasurer you're referring to, correct? Yeah. So that's, I'm in agreement with that because it's a separate, it's separate. I'm good with that. And then we're not going over the allocation for them in that next category. Is that basically what you're thinking?
I've got Madam Auditor and then you, Mr. Treasurer. Madam Auditor.
Mr. Chairman, I agree with that, except that there are items on this list that I don't, the allocation does not mean that you get up to that amount regardless. We as a board still have the obligation to make sure they are items that are that comport with the guidelines. So I struggle with just giving an allocation without indicating what items are appropriate to spend it on, would be my concern with that thought process.
Thank you.
Microphone, please.
Right, so Superintendent, go ahead.
I thought I heard the secretary talking, but he didn't have his microphone on, Mr. Chairman. I don't mean to interrupt. Okay.
No, his comment was simply a motion would be appropriate, so.
Fantastic. So I concur with the auditor as well. This is not, sort of this, here's your allocation. This is a good list, but you're going to have to pare it down. Has not really met the litmus test in previous requests. And I'm uncomfortable not having Campbell County identify what they want to take away from this list to this board or in their application. I agree, and again, without restating, I just would agree with the auditor's comments previously.
Okay.
Mr. Chairman, just for the board's assistance, Beth does have the spreadsheet called up, and if there are certain items that the board wishes to remove, she can tell you the dollar amount remaining on the list after that.
Okay. So I see the auditor and the superintendent both have their hands up. Madam Auditor.
Mr. Chairman, and again, not knowing how everyone else is feeling, I've sort of roughshod come up with what I think are that I would be comfortable with supporting today so that they can put these things into use and have them be, useful during the covered period. And I think there's a question, like the superintendent said, what the applicant might prefer to take off their list. But I think also some of these are a question as to what our capable legal team thinks that we can defend on the back end, because I want to be protective of the entity in that way. So I can, if and when the board is ready, I can certainly take a stab at what I've come up with line by line, and I'm not married to any outcome.
Okay, thank you, Madam Auditor and now Superintendent.
Yeah, Mr. Chairman, I guess at this time, because we've made this a fairly iterative process, I wonder if Campbell County, given the fact that they have been part of this conversation, have a list to propose as well that we could perhaps pair with the auditor's list. And if they don't, or if they'd rather, I would really, really appreciate hearing the auditor's list.
So your request then is, I presume, for Ms. Tate, is that correct?
It is, Mr. Chairman, if she cares to, or we can start that process as well. Just ensuring that it remains iterative.
She has her hand up. Ms. Tate, I'll give you the floor.
Thank you. To Superintendent's point, I would love to hear what Auditor Racine has to say as far as what she would like to see on her list, and then I could respond back to that.
Okay, Madam Auditor.
A lot of pressure, Mr. Chairman. Okay, and please keep in mind, this is my on-the-fly thought process. And again, my other caveat is that I think potentially some of the items that I have shorthanded as no's might become yeses at a later date with additional documentation and or advice of staff. But so what I have down as fund today would be hooks, the stethoscope, the thermometers, vital signs, towers, and cuffs. I would then say no today to the laptops, iPads, and stations. I feel like we have also declined other large technology change requests similar to that. I would also note I'm going off a rough memory here, so correct me wherever. I would approve the plexiglass nurses station. I would deny the portable oxygen units. Based on Ms. Tate's testimony, it sounds like this is a need they already have that isn't really related to COVID. They just have a lot of residents that need oxygen. I would say yes to the bariatric mattresses. We've approved that before. I would say no to the wheelchair cushions. It seems like that we should have good cushions on our wheelchairs in all scenarios. The next 4 items that are a group, housekeeping cart, garbage cans, hanging bags, and hygiene stations, I would say yes to those. The vacuum and the HVAC to prevent hail damage are the two that I probably have the most questions on. I could go either way on those. Dishwashers and visiting booth I thought was okay. We have in fact approved multiple visiting booths. I would say no to the hearing amplifiers, the golf carts, outdoor sound system, virtual reality system, Kindle 8, mobile activity carts for supplies, and painting and recreation supplies. The access points for legacy, I would decline that in the absence of additional information. I feel like that's a need that was already there and is connected to the other IT requests. And then I would approve the bipolar ionization and decline the video conference. And again, Mr. Chairman, I am absolutely not married to any of those, but the approval of those today would add up to 306,698. But again, that's just my rough first pass.
Okay. Thank you. Ms. Tate, afford you the opportunity. I think you said you'd like to hear the auditor's list and then have the opportunity to respond.
Yes, I appreciate that. First off, Auditor Racine, I came up with 275, 498, so I'm not sure which one I missed. But I'll speak to the ones that you've declined, and if it's one that you've included, I'd appreciate that feedback. As far as the computers and the iPads, we did not need those initially. We've been running the legacy for many years without those items. Those are specifically due to COVID and the fact that we now need to be in the patient rooms a lot more often. We cannot have the documentation being done out in the nurses station, as well as when the patients are in isolation, we need to have those computers in the room in order to document everything that we're doing with that patient while we're in that room. So those are directly related to the COVID response. The oxygen units, yes, we did need those previously. However, we're needing more because of COVID. So we do have enough on hand right now to take care of the residents, but we're having more residents need oxygen due to COVID or due to their lack of activity. And so they're needing oxygen added too because of COVID and not being able to be out and about. We do physical therapy with them, but we do have a number of residents who are needing oxygen because they don't have that contact with their family. They're depressed, they're not breathing as well, and so we're needing to put them on oxygen. So that is, the additional units are directly related to COVID. Understand your thoughts on the wheelchair cushions, and yes, we do have good wheelchair cushions. These are special cushions because the residents are in their chairs much longer periods of time. Once again, because of depression, more and more of them are not wanting to participate in activities and getting out of their wheelchairs, and so they're staying in their wheelchairs for a much longer period of time because they're depressed. Then they're not wanting to participate in activities, and so these are special cushions to help reduce pressure ulcers. Understand on the vacuum and the HVA covers. Once again, I could see the vacuum. I'm willing to not have that one be funded, but once again, that is for the COVID unit specifically. The HVA covers, I think, are necessary, but if we're trying to cut the $34,000 to get down to our allocation method, that is definitely something that we can forego to cover the difference gap there. But once again, we do feel it is a necessary item because of the COVID. The other items at the bottom that you've declined, which are essentially quality of life items for our residents, the hearing amplifiers, the golf carts, outdoor sound system, virtual reality, Kindle 8, and mobile cart for activities and painting supplies. I understand that you don't feel that they're related to COVID. We respectfully disagree because the only reason we're asking for those is because we need to entertain the residents because of COVID, with not being able to get out into the community, not be able to visit with family. To the true sense of healthcare, no, it's not Band-Aids, it's not medicine, but it goes to the mental well-being. And studies have shown, particularly in long-term care situations, the mental health of these residents are diminishing quite quickly because of COVID and the limitations that the CDC and CMS have put on to long-term care families and resident homes like the Legacy. The access points to Legacy, once again, we were fine with our access points pre-COVID. We were not having any issues with connecting devices. Post-COVID, we're using a lot more devices. We're using a lot more phone calls, a lot more video visits, and that is the reason for the access points. Had COVID not hit, we would not be replacing the access points. These are additional supplemental, as you can imagine, 141 residents and staff making phone calls, video visits, that type of thing, as well as visitors coming. We just don't have the capacity post-COVID. So the access points are adding because of COVID and the device usage increasing so dramatically. And then same thing with the video conferencing. our initial request for the hospital did include video conferencing that was funded, but we did not see the need at that point for legacy. However, hindsight's 2020, and we now need a room for video conferencing at the legacy unit.
Mr. Chairman.
Yes, now auditor.
Just really quick, and Ms. Tate, thank you for all of that clarification. The one thing I wanted to correct, I in no way meant to portray that the items weren't related to COVID. I think this board has very, very much recognized that some of the mental impact to residents and families utilizing these facilities is massive. And one of the fallouts that we're absolutely having to deal with, it is more of a question of these do not comport with the federal guidelines, and we have consistently denied them to other applicants throughout this process.
Thank you, Madam Auditor. Other comments? Hearing none. Auditor, would you like to make a motion?
So, sure, Mr. Chairman, I can start with one and have it be amended. And Ms. Tate, I think the difference in our two numbers was that in my quick list, I had included the two I was feeling iffy about, meaning the vacuum and the HVAC, and I think you hadn't. So I think that was the difference. I do want to make a motion. Miss Tate, is timeline going to be a problem with any of these things?
Madam Auditor, yes, it will be. We have started pursuing some of these items on the list. However, if we do not execute some of the items here shortly, we will not be able to get them by the December timeframe.
Mr. Chairman, just a quick follow-up. So, Ms. Tate, is timeline a problem even if you get approval today on any of them? And I think the main ones would potentially be your IT endeavors and covers to the HVAC system, but I guess that's not necessarily a CapCon item per se.
Madam Auditor, I would need to go back to the IT department. I know we have quotes for all of these items that we included in our initial application. Once again, this has been tabled since last month. And so at that point, all of the vendors had guaranteed us if we had orders in by this week, they could guarantee the December timeframe. I would have to go back to those vendors to find out if we delay for a couple more weeks, if they would be able to get us those items.
So, Mr. Chairman, I'll start us out with a motion and we can go from there. Recognizing.
Okay, and Madam Auditor, I appreciate that. I just, what I'm going to suggest is that when you walk through this, we'll have Beth. I think, Beth, you can do the real time. So we'll just calibrate with Beth as you make the recommendations and go over that before we proceed, if that's okay with you. So, Madam Auditor, please proceed.
Thank you, Mr. Chairman, and sorry for getting so down in the weeds. I would make a motion that we approve today to Campbell County Health, the legacy facility, hooks 480, digital stethoscope 3590, infrared thermometers 530, vital signs towers and cuffs 11844, plexiglass around receptionist desk and nursing station 21407, the bariatric mattresses 10,500, Housekeeping cart, garbage cans, hanging bags, hygiene stations. 1,400, 1,120, 1,100, and 4,000. Dishwashers, 13,400. Visiting booth, 25,500. I actually am going to add in the amplifiers there, 3,500. I feel like there is a connection between those two. They're sort of more related. And then I'm going to go down to the bipolar ionization and the amount of 180,627. And then I am going to add in with the additional information video conferencing for 125,000 even. And Mr. Chairman, Beth will correct me, but I have that around 403,998 for today as a starting point.
So Beth concurs. 403,998. All right. And that's been seconded by the superintendent. So any discussion on the motion? Madam Superintendent. Oh, you're muted, Madam Superintendent.
Thanks so much to the auditor and Campbell County for just making this a collaborative process and working through this. I really appreciate the work and the motion that allows me personally to be able to support it.
Thank you, Madam Superintendent. Any other discussion, Mr. Treasurer?
Yeah, I'm not sure whether video conferencing, how good it'll work without the access points. Maybe some discussion from Campbell County on that. And then the question is, to, I guess, jog my memory, have we been denying I guess the electronic aspect of patient management previously? I thought we had passed some of those, but we've been denying that previously.
Ms. Blackwell.
Mr. Chairman, Mr. Treasurer, I believe historically we have been denying those. A lot of them were just upgrades to their systems, not additions to their systems, where this is an addition to their system. So you have been denying those.
Okay, so I guess some clarification from Campbell County. Is this an addition? You don't have the patient management systems now electronically, and this would be an addition to that.
So Ms. Tate has her hand up.
Thank you for
Ms.
the
Tate.
question. Yes, thank you for the question, Mr. Treasurer. We currently have an electronic EMR system. These are additional devices that we do not have today in order to document. Unlike a hospital, a nursing home typically does not have as many electronic devices in patient rooms to document in rooms. They're mostly done at the nurse's station. So we do not have devices throughout the facility because in the past we have not needed them. However, COVID has required us to obtain additional devices in order to document patients' vital signs, health and well-being within their patient rooms. So, and then to your other point about access points, to your point, yes, video conferencing, adding that capacity potentially could overload our access point system, and it would not work well unless we upgrade our access point system.
Thank you, Ms. Tate. Mr. Treasurer.
Well, Mr. Chairman, I guess to that point of the video conferencing not working well, like buying a great TV and you can't watch it. So I guess I would say I'd move to add in the access points for the legacy system, so the video system would be functional.
Okay, I'm going to ask the auditor if she would accept that as a friendly. She does. And the seconder also accepts it as a friendly. So the video conferencing is back in. And that brings us to 518,998, is that right?
Mr. Chairman, I have $519,498.
Madam Auditor, does that number meet with you? I was adding 115,000 to 403,998. Is that correct?
Mr. Chairman, I do not agree with that, but I could be wrong. I have 518,998.
That is my,
Yeah, it's Monday.
is that correct? Okay, that is correct. Sorry, that was my envelope scrawl. Okay, thank you. Is there further discussion? The motion has been amended with a friendly amendment. Is there further discussion? Further discussion? All in favor signify by saying aye or a thumbs up. Aye. That motion carries.
Okay, Mr. Chairman, that concludes our agenda for today's CRG program funding.
Thank you, Madam Director. Thank you, everybody who's been on the call. Thank you, Ms. Blackwell. Thank you, board members. I just want you to know I kept my promise. You have 17 minutes till lunch is over. Thank you very much. This meeting, I think, can be adjourned. And so we stand adjourned.